Good morning, good afternoon, good evening to all our worldwide audience, to all IIUans, wherever you are now. I, Professor Nada Ratkovic, the co-founder of IIU Europe, the president of IIU Research Center, country director Croatia, and board member of IIU, heartily welcome you with the big and warm greetings to all from the International Internship University on the auspicious occasion of G20 Summit 2023, jointly organized by G20 International and IIU International Internship University on the envisaged topic for today, One Health Quadripartite. What to say after many weeks? We are here today again. We want to celebrate, collaborate, communicate, and catalyze the changes to contribute to the citizenship, community, and country. Today, here, first let us start and let us say something about our amazing organizers. So first, let us start from our founder, Sir Piyush Pandit, the visionary educationist who is always having a dream to provide education to every learner across the world. He believes that the world is changing drastically, so there is no need to make changes in the education system. With this thought, Sir Piyush Pandit concocted the world's first digital internship university, International Internship University, in 2020. So IIU is providing quality, skill-based, affordable, accessible, location, and independent and skill-based digital education to all the learners across the globe, along with internship opportunities, research facilities, through its 1,000+ virtual courses to all the learners across the globe, and through the platform of massive open online courses, the MOOC, with the aim of promoting internships, opportunities, and research facilities to its learners. IIU has been accredited, affiliated with the World Education Organization, WEO, and International Accreditation Organization, collaborated with all the world's top universities, educational institutions, and United Nations. In a short span of time, IIU has spread its wings in 195 countries, 6 continents, with a theme of 1,000 experienced and qualified global educators across the world. IIU is registered in India, Australia, Nepal, with USA government, and is spreading in so many new countries all around the globe. So digital education by IIU is for all, without any hurdles, as per the own wish of the learners and without any financial stress, which is easily accessible in every corner of the world. So this G20 summit is really something what we are honored and grateful to have. The group of 20G20 is a paramount platform for fostering international economic cooperation, pivotal in shaping and fortifying the global framework and governance concerning crucial economic matters worldwide. India is proudly assuming the presidency of G20 from December 2022 to November 30, 2023, embraces the opportunity to spearhead changes. Guided by the resolute leadership of Dr. Srividhya Sukumar from the United Arabian Emirates, and with unwavering support from the esteemed International Internship University, the core committee and team, we are prepared to unveil a transformative initiative. IIU is poised to launch any empowering endeavor to revolutionize the world of women and social entrepreneurs. Additionally, we are set to convene the esteemed worldwide think tank to foster comprehensive discussions to achieve equality for all, an equal world for everybody, education and opportunities for the all individuals. With the upcoming G20 summit being organized virtually, we have the unappreciated opportunity to transcend geographical boundaries and bring together brilliant minds from all corners of the globe. We can pave the way for a future where everyone can thrive through collaboration, innovation, and collective determination. Let us join together, our hands united in our pursuit of a world where every individual, irrespective of their gender or circumstances, can unleash their full potential, contribute to the progress, prosperity of our global community. Together, we can make a lasting impact and create a legacy of equality for generations. So, let us continue. Let us explore the myriad benefits of internships, highlight the shape of students' future, unlock our potential. Now, I want to invite our core team member, Dr. Virginia Riviera, to continue and introduce our great IIU team. Dr. Virginia, welcome.
Thank you so much, Professor Nala. I am super excited to be here today. Commemorating what is the G20, I think the topic that we'll be discussing is paramount to every single human being that lives. We'll be talking about health and environment, and I think that these two are so important to speak about. I am very, very honored to present a marvelous team, a faculty that really shows no comparison. With us today, and always, we have Dr. Snigdha Kadam. She is our project coordinator. We also have with us today Dr. Inga, and let me get Inga your last name that I always hate, like Karsilava. Did I get that correctly? Karsilava. Thank you so much for being. I have to say that she is from Georgia. She is the president of our IIU in Europe. And not only that, she's a master educationist. So very, very happy to have you here with us today. We also have with us Sandy, Dr. Sandy Balahi. And I have to say that Sandy puts that incredible touch to every single one of our speakers and really helps us understand every single one of the topics that we have. Additional to that, I want to thank today our partners, and these are our partners. We have two of them today. Let me get this immediately. And we'll be counting with let me see right here. GFN, okay, let me get it correctly. We have iGen, the 74 million young Americans born between 1995 and 2012 comprise the most important generation in the nation's history, both in size and composition. 1 out of 4 Americans from age 5 to 22 have been collectively dubbed the iGen generation, a shortened descriptor for internet generation. The iGen handle won over numerous suggested names. These names could have been Generation Z, which was doomed to failure because there was no context provided by any other generation preceding it. That generation was also known as the Millennials, 1981 to 1995. Other Generation Z replacements include the Homeland Generation, Centennials, Post-Millennial, the Founders, iGeneration, and no doubt others, all of which fell to the wayside of public opinion. That generation has its own moniker because it's very, very unusual, given the names of population groups from the past. Those several periods gaining between 12 and 25 years were known as the Lost Generation, the Interbellum Generation, the Greatest Generation, the Silent Generation, and its subset, War Babies, Baby Boomers, Generation X, and the most recent group, Millennials. Not only iGens has it become the largest social cohort, outnumbering Millennials and Baby Boomers, the iGen generation or iGeners is also the most ethnically diverse generation compared to its predecessors. So this is key when it comes to discussing education and any other topic that we'll be discussing that will affect the future of the world. Thank you.
We have other partner as well, GSFN, Global Sustainable Futures, and all our Dr. Syed and Dr. Herbert Coach are representing GSFN today.
Thank you, Dr. Virginia. I want to say also that we want to thanks to our trustees, Madame Roshni Lal. She's our role model. She's our strong pillar of IIU. We have amazing ladies. We want to thank to Ermina Rescue, who is the president of the Women's Entrepreneurship. Also we have others in our core team member. We are thankful to all, but especially we are thankful to our great founder, Piyush Pandit. So let us continue. Let us invite this amazing lady, Dr. Srividhya Sukumar from United Arab Emirates. She is a very, very powerful lady. You see this G20 summit with her. This is really a big, big pleasure and honor, and we are grateful, humbled, and blessed to be with you, Dr. Srividhya. Welcome.
Thank you, Dr. Nada, and thanks to each one of you who is present here today amidst us with us. And I would like to give my hand to Dr. Virginia to begin with the introduction of GSFN, and then I will proceed with the topic. Hope I can do that, Dr. Virginia. Yes?
Yes, I am going to get that information, then I'll do it immediately. I think for some reason I lost it. Yeah.
Right. Okay, fine. Then I'll leave it to you. Then Dr. Virginia will introduce GSFN. So today's topic, we are going to talk about health. So when it comes to health, we all know that good health is the crown on the head of the well person that only a sick person can see. Oh, I don't say that, but one Mr. Robin Sharma said that. And it is health that is real wealth and not the piece of gold and silver. And the great wealth is actually the health. I hope everybody will agree with me. On that note, we are gathered here today to talk about the health. As Dr. Nada was introducing today, we are going to talk about One Health Quadripartite. What is this quadripartite? Everybody will have this question in mind. The quadripartite organizations or the Food and Agriculture Organization of the United Nations, FAO, and the United Nations Environmental Program, UNEP, and the World Organization for Animal Health, WOAH, founded as ORE, and the World Health Organization, WHO, collaborate to drive the change and the transformation required to mitigate the impact of the current and the future health challenges at the human, animal, plant, environment interface at global, regional, and the country level. Responding to the international request to present the future pandemic and to promote the health sustainably through One Health approach, the quadripartite has developed One Health Joint Action Plan for the year 2022 to 2026. So the One Health Joint Action Plan, in short, it is called as OHJPA, outlines the commitment of the four organizations to collectively advocate and support the implementation of the One Health. It builds on, complements, and adds value to the exciting global and regional One Health and coordination initiatives aimed at strengthening capacity to address complex multidimensional health risks with more resilient health systems at global, regional, and national level. So raising the bar, One Health Joint Action Plan, that is OHJPA, desired impact is to make our world a better place, to prevent, predict, detect, respond to health threats, and improve the health of humans, animals, and plants, and the environment, while contributing to the sustainable development. So how it does it work to? That is providing the framework for the action and the purpose of the set of activities of the four organizations that can offer together to advance sustainability, scale up One Health, provide upstream policy and legislative advice and technical assistance to help set national targets and priorities across the sectors for the development and the implementation of the One Health legislation, initiatives, and the programs. Take stock of the exciting cross-sectoral global and regional initiatives around One Health, identify and advise on the synergies and overlaps and support coordination. Mobilize and make better use of resources across sectors disciplines, and all stakeholders. So OHJPA, that is One Health Joint Action Plan, is guided by the set of theory of changes, and the change makers use One Health principles to strengthen collaboration, communication, capacity building, and coordination equally across all sectors responsible for addressing the health concerns at the human, animal, plant, environmental interface. To build up this 6 interdependent action tracks that collectively contribute to achieving sustainable health in the food systems and the reduced global health risks and improved ecosystem management. We are gathered here on the platform of IIU to address, we have identified the priority areas for deliberation that includes, and we have eminent speakers who have showed their welcomeness to have their contributions registered here with us today. On that note, I take this opportunity to welcome all speakers who have gathered with us on this platform. Thank you so much, sir, and thank you so much, madam. So to begin with, the pointer number 1 is curbing the silent pandemic of AMR, will be presented by Dr. Herbert Mandler from South Africa. Point number 2, reducing the risk of the emerging and the re-emerging zoonotic epidemics and pandemics, will be presented by Dr. Augusta Elizabeth. The global upsurge of food and water safety hazards will be presented by Ms. Sanya, I'm sorry. And the point number 4, the links between the health of the environmental and the humans and the animals and the plants, will be presented by Ms. Shyama Hafiz Marika. Point number 5, raising awareness and the advocacy of One Health, will be presented by Dr. Dragan Jovanau. Point number 6, integrating the environment into One Health, will be presented by Dr. Saeed Adebesi. Point number 7, support One Health funding for investment, will be presented by Professor Dr. Jose Esteves. So kindly join with me to welcome all our eminent speakers with us today. Thank you so much. And the insights shared by the experts on the above pointers will aim to contribute the archives of the policies that will expand into health, including health, and need the collaborative and the swift action to ensure a healthier and sustainable future. And the highlight will be the need for resilient health systems that can effectively respond to health emergencies while addressing the broader environmental and ecological issues. So we welcome you all to join us on this platform and the collaborative effort. Thank you so much. On that note, I extend a warm welcome to one and all. Over to Ms. Nada. Thank you.
Thank you. I would like to talk, can I talk about, I'm going to present really, really fast, our community partner. The GSFN has been established to provide a common platform that helps its members, financial institutions benefit from opportunities emerging through transformation to sustainable economy. It supports its members in developing capacities to integrate sustainability across the board. It also fosters initiatives that help build public-private partnerships, promoting sustainable lending and investments. It offers networking opportunities to members, financial institutions, multilateral organizations, government bodies, businesses and industry, and other stakeholders for sharing experiences and ideas. And it provides a forum to support the development and execution of sustainable finance policies and practices. They present a marketplace for members to promote their sustainable finance expertise, business ideas, products and services, and to search for partners to develop and execute programs together. Perform any other tasks that promotes sustainable finance. Thank you so much. Thank you. Now we have them.
Thank you, Dr. Virginia. Thank you.
Thank you, Dr. Virginia. Now we will invite one beautiful lady, smart lady. She's coming from India and she's here in this G20 summit involved with her full heart, with her full mind, our beautiful Dr. Sandy Balaji. Welcome, Dr. Sandy.
Thank you so much, Dr. Nada, for your kind words. And definitely, I cannot miss this learning experience. Thank you so much for the opportunity as well. So, may I just go ahead and begin with our today's session?
Yes, you can. Yes, you can. As our great Dr. Queen Elizabeth said, today we miss her. Yes, we can.
Yeah, absolutely. So today we are talking about health. And when we talk about ill health, the first thing that comes to our mind is germs or little microorganisms that probably are affecting our health. So antimicrobials that may include antibiotics, antivirals, antifungals, or antiparasites. These medicines that are used to prevent and treat infections in humans, animals, and plants, when they become resistant and they become stronger, they are often referred to as superbugs, and that itself is posing as a challenge today. So, to address or to curb this antimicrobial resistance is one of the greatest challenge that will help us in achieving the SDG number 3, good health and well-being. And to talk about that, we have with us Dr. Coach Herbert Mandla Mutowo. That's how I see your name, Dr. Coach Herbert. I hope I got your name correct. He's a group CEO of Total Business Global Training Executive and Executive Director of Jordan Touch Communications. He's a public motivational speaker, serial entrepreneur, leadership and life coach, counselor, and he's passionate about writing and public speaking. He's a consultant and he develops manuals, and he's passionate about the less privileged, especially the orphans and vulnerable children and youth, and he empowers them. So last year in August, he established the African Entrepreneurs Network, through which, by developing and building business, he wants to improve the lives of people in Africa. So as he is passionate about orphan care, adoption, and training, he also trains caregivers in the early childhood development. And he's also the programs director at Heal Children Foundation, Namibia. Welcome, Dr. Coach Herbert. We're looking forward to your inputs on curbing antimicrobial resistance.
Thank you so much. Good afternoon, everybody. Good morning to wherever you are. Should I go ahead, Doc, and speak?
Yes, please.
Oh, okay. Should I put my PowerPoint presentation? I shared it with Dr. Sukumar. I don't know. Can I?
Yes, you can. Yes, you can.
I can share mine. Okay. All right.
Yes, you can.
Thank you so much for this. Thank you so much for this platform. I am greatly privileged and humbled to be part of this important topic when we discuss about health. I think in my travels, both as a consultant and working from consultancy for organizations like EPOS Health Management in Germany and GIZ, I found health to be a very important aspect of our lives. While I'm talking, let me quickly share with you my PowerPoint presentation so that we can go through it together. Thank you so much that we could gather and speak on a very important matter, and which I believe is very important to us all. We cannot have economic building, we cannot have educational facilities or communities which are healthy as long as we neglect a healthy aspect. I'm not sure if you can pick up. Okay, I got it. I was looking for it, sorry. I'm going to run through and talk of some experiences that I've gone in some of the different countries that I've traveled. To me, this is quite a very profound topic and important based on my experiences that I've been involved in. During COVID, I was at Steve Biko Referral Hospital in Pretoria. I happened to be a patient there because of other circumstances. But some of the things that we're talking about here are things that I've experienced. I've also had trips in different countries, which I'm going to mention, where I have seen how important it is curbing the silent pandemic antimicrobial resistance, which I think in developing countries is a huge challenge. Let's quickly run through as we look at them. What are we talking about when we're talking about what is antimicrobial resistance, and get into details and see how developing countries are really affected. And also some developed countries, some communities are also getting the challenges of this. It is the ability that we all need to be able to understand to resist I think my writing wasn't very good. Microorganisms to resist the effects of drugs designed to kill them. I have been in very impoverished communities in Africa and even in modern societies that have found out this topic specifically is important even for our African governments and for some developing countries, governments to be able to look into and begin to address it for the benefit of many. This platform, I think, has done really important to be able to share this. What is it that we're talking about here? And what are the impacts of the global impact of this topic that we have today, antimicrobial? Let's look at it from a global perspective, not just from a continental or from a regional or from a national point. Number one, it does threaten the effectiveness of antibiotics and antimicrobial. I had experienced some 4 or 5 years ago. I was working in Chimoy, Mozambique, and Manica. I remember I was a consultant for about 3 months. I fell sick. And I was staying at a specific hotel. I was invited for that period of time. So most of the hospitals were closed and healthy facilities were closed. And the manager at this bed and breakfast that I was staying, they said to me, "You look like you have malaria. Just go by the streets there, you get all the medications that you need of malaria drugs, related drugs." And it was really bad. I couldn't access an open health facility at that time. So I went in and I bought some of the malaria treatments. As I took them in my bed and breakfast, it was on a Saturday. I literally got worse. And on a Sunday evening, I was rushed to an emergency hospital. And when I was rushed there, I was not then understanding that the importance of looking at the expiry drugs. There's always that pharmaceutical requirement when drugs are expiring. And then they took me to a private hospital on Sunday evening. And then I took along the medication that I'd been taking. And then they looked at it. And then they looked at me and they said, "What do you do?" And I said, "I'm a consultant." And then they said, "Oh, you're a consultant, you pick up this drug." I said, "I couldn't find any that was opening." The people who recommended me, they said I can get some treatment on the streets. And they looked at them, they were long expired. But this is important. The Minister of Health was and is aware, I don't know if it has changed now, was aware of drugs being sold on the streets which were long expired. Number two, what is the impact of this we're talking about today? The antimicrobial, the impact in the world is it increases healthcare costs and mortality rates. And lastly, it hinders progress in medical procedures like surgeries, treatments, and other organ plants, because many a times people are buying or misusing the drugs and buying antibiotics that have expired. Here are some factors contributing to AML. The overuse and misuse of antibiotics. I give an example. Last year I was in Zambia, capital city, Lusaka. I happened to go with a family member at a pharmacy which is non-pharmacy in the country, in the city. Lusaka is the capital city for Zambia. and then they say maybe they are not feeling well. They went to buy antibiotics without any prescription from a medical doctor. And I have seen that happening. A lot of people who are not knowledgeable of drugs, not knowledgeable of treatments, just come in the pharmaceutical world and in the pharmacy and access these drugs. The danger that it does is exactly what we are talking about here, how we can curb the silent pandemic of antimicrobial resistance. And these people, they keep taking medication which they have not had a doctor, a medical doctor prescribed. They can talk over the phone and say, no, you can get this. So let's look at the factors contributing. In developing countries, there's inadequate access to clean water. It's hardly there. Poor hygiene and sanitation practices in health settings. And this is continuously happening in many African countries, whereby these things are also contributing to what we are having as a challenge to the silent pandemic of antimicrobial resistance. And it's something that requires African leaders and developing country leaders. And I'm so happy for this platform, for bringing this topic, because it is one of the ways that we can address this, or we can curb this. Let's look at consequences of AMR. Patients have limited treatment options. There is prolonged illness and increased mortality, increased healthcare costs, disruption of healthcare systems, economic impacts on countries and industries. And it's unfortunate, it's never given the due attention that is required and that it is needed. Let's look also, we need to look at the effective strategies to combat AMR. Number one, we need to promote antibiotic stewardship, which requires the private, the ordinary people on the street, health bodies, medical practitioners, health facilities, by educating healthcare professionals, patients, and the public about appropriate antibiotic use. Number two, by encouraging prescribers to only prescribe antibiotics when necessary. The Zambia experience, where I told you in Lusaka, people are just taking antibiotics without a prescription from a doctor. You just go over the counter at a pharmacy and you pick up antibiotics. This is really risky. By developing and implementing guidelines for antibiotic use in healthcare facilities, which requires the government, which requires the specific ministers and ministry, the departments that deal with this, they need to be able to know that people are accessing these things and on the streets without proper prescription. And how do we improve around this in terms of prevention? By strengthening hygienic practice, one of the challenges in Africa and developing countries is access to clean water. And these, they contribute immensely. They contribute a lot. Lack of access to clean water, lack of access to hygienic practices in various communities, it is also a contributory factor, which can be looked at and be dealt with at both developmental level and at healthy, hygienic level, and both at community level, so that the people are able to access clean water. By implementing effective and sterilization techniques, you will find also in most developing countries in Africa and part of the world, in many communities, you find the person goes to have their hair done. There's no sterilization within some of the salons that they're accessing this, and it comes back again. It makes them resistant to one of some of the most important treatment of medication that they've been given. By isolating patients, it also helps in reducing infections to prevent spreading of it. And many a times it's not happening there. When I was treated, hospitalized at Steve Biko Hospital. Steve Biko Hospital is one of the big hospitals in South Africa and one of the biggest referral hospitals in Southern Africa. But a lot of the sterilization equipment wasn't available. Even you look at issues like gloves, medical gloves that the nurses and the health facility, health staff are wearing, it wasn't available. So many a times it comes back and affects the patients, it affects everybody, and it makes the resistance such a big issue, yet it can be dealt with and effectively done away with. How do we then do and curb this by also enhancing surveillance and monitoring, by establishing robust surveillance systems to track AMR trends in different countries, in different communities, in different locations, depending with how the health systems are set up in those countries. If you look at Mozambique, look at currently DRC Congo, you look at Angola, there are countries that have been affected by war. And many a times the government are mostly concentrating on developing the economy in terms of structure, and healthy is not given its due attention. By sharing data internationally to monitor global patterns and such platforms which have been organized, very important platforms, such data is made available. So you begin to look at the impact. It's not just a very small impact, it's huge. We need to identify emerging resistant trends early for prompt action that can be dealt with. And then we also need to be able, as we curb on this pandemic in terms of how it's impacting on health people, we need to invest in research and work a lot in these developing countries where research is done concerning data, concerning patients, concerning communities that have been going through the resistance in terms of antibiotics, by funding research for new antibiotics and alternative treatment options that can come within the health sector. We need also to be able to encourage collaboration between researchers, pharmaceutical companies, and health agencies, which I believe is exactly what we're doing here. These collaborations, these platforms, and the way we are reaching out live and being on social media, it actually gives people the opportunity to be able to access and see how important this topic is. By supporting studies on novel diagnostic tools to detect resistant infections quickly, which unfortunately in the developing world is not done, because the developing world, they are more concerned about bread and butter issues. They are more concerned about sending children to school, but we can only send our children to school when we also address holistically the health aspect. Health is part of education. Health is part of also addressing and alleviating poverty. We need international collaborations. This is one of collaborations which I believe is incredible for the world and for addressing this specific topic which I'm talking about. Recognize that AMR is a global problem requiring coordinated efforts of many partners. It's not an individual, it's not isolated to only those in the health sector. From a counseling psychologist point of view, I've dealt with these things. You find clients who are taking drugs, and most of them, they're taking drugs, even at times they are not monitored as to check on the effectiveness of the drugs, or maybe there's need to change drugs because of either the things that they're exposed to, or whether the drug is effectively working. All drugs, they work in a certain period of time. They are not going to be working forever. The doctor either will ask you, are you allergic to this? Are you taking alcohol? All these are contributory factors, but many a times, because we get so busy in the field, we hardly look at this. Number two, by establishing international agreements and partnerships, which we are currently also doing here at this platform, share best practices, data resources across countries. That it has to be accessible, available, the data, the practices, and the resources in different countries, whether it's in Latin America, whether it's in South America, whether it's in Asia, whether it's in Africa. We are all facing the challenge that we need to curb the silent pandemic of AMR. Such platforms like this one are also helpful and will help a great deal. We also need to do a lot of public awareness and educational campaigns, very important. Launch public campaigns to raise awareness about AMR. And this is one of, I think this is a public launch, though being done in an organized manner, but you go on Facebook, you find it's live on Facebook. It's actually basically a way of promoting awareness and people beginning to access and to know the details around this. Educate the public on the importance of using antibiotics responsibly. Highlight the link between AMR and individual and code. This is important because many a times the individuals, they are not aware of anything. They are not knowledgeable about anything. Just imagine to think of how many people are doing the same, walking into a pharmacy and buying different, the antibiotics are differently packaged, differently made for specific areas to be addressed healthy-wise. They're not just going to be, it's not just because you're taking antibiotics, it's applicable for this, it's applicable for this. They have specifics that they have to be applied. But the public is not really knowledgeable about these things. And it's unfortunate. It has to be made intentionally by ministries of health, departments of health in different locations, in different countries, so that people begin to understand. One of the most important things is governments to have policies and interventions around this. Let's build policies. Let's promote policies which can be done in the academia field, that people need to understand their policies. Government come up with interventions, working with people in the field. At national levels, develop and enforce regulations on use of antibiotics in healthy care facilities. In developing countries, this is such a huge challenge. Support research initiatives through grants and funding. Incorporate AMR strategies into national health facilities so that it doesn't become an isolated issue. People need to understand how huge, how impacting negatively use of antibiotics without the clear knowledge, without the write-up of the medical doctor or specific psychologist or whoever in the health facilities is giving these. In conclusion, antimicrobial resistance is a significant global health challenge, of which collectively, you and me, in the field, we can put our efforts to address it. Addressing AMR requires a multifaceted approach involving everybody in the field, health professionals, policymakers, government, at governmental level, researchers, industries, and the public. By working together, we can curb the silent pandemic of AMR and safely have the correct use of medicine. And by so doing, we literally help with the concern of One Health for the world. And practically, it's achievable. It's a whole lot of consultation. It's a whole lot of engaging. It's a whole lot of, this platform for me is quite profound as we are addressing this aspect. It's not isolated only to developing countries. Even in developed countries, you visit some communities. You can go to Brooklyn. In a certain community, you find people who are just accessing antibiotics without the clear knowledge. Is this specific antibiotic for what I am taking? Ladies and gentlemen, thank you so much for this platform. This is Dr. Herbert, and I am done with my presentation. Thank you so much for the organizers for such an incredible platform. And I look forward to such as we address these things and challenges such that the world can stop and pay attention to this, have documents written, have a whole lot of research and platforms created. Thank you so much.
Thank you, Dr. Herbert. That was a brilliant start for today's evening. Well, addressing about the growing threat of antimicrobial resistance, that is AMR. In short, it is called as, and it is, of course, it is recognized as the leading cause of the death around the world, with the highest burdens in low-risk use setting. And as estimated, 4.95 million human deaths were associated with the bacterial AMR in the year 2019, as you rightly mentioned, including 1.27 million deaths attributed to the bacterial AMR, antimicrobial resistant collaborators that came up in 2022. And AMR also threatens the health of animals and plants. It doesn't leave anything around the globe, which has aggravated to the growth food with effects to the food security, food safety, and the environment. As you rightly mentioned in your presentation, we need to come up with policies. We need to come up with interventions. We need to come up with strategies and to hold the play of crucial role in the health of the humans, animals, and the plants, as well as the food safety and the food security. However, we do accept with you on this platform that is an ever increasing and widespread threat driven by the overuse and the misuse of the antimicrobials in the human, animals, and the plant sectors. There are many, many social and environmental factors that accelerate through the emergence and the spread of this resistant genes and the pathogens between the humans, animals, and the plants and the environments, as you rightly mentioned during your presentation. Thank you so much for those great insights. You have covered almost every single point which is required. And of course, this includes the insufficient access to the health services, as you rightly mentioning, taking the name of few countries as well, inadequate production and housing and lack of clean water, poor sanitation, waste management system and the hygiene and insufficient regulatory frameworks and the lack of awareness, as you rightly mentioned, and the education about the risk of AMR and the appropriate use of antimicrobials. Thank you so much, Dr. Herbert. It was a beautiful, brilliant start that you have given. Moving further, we have another, the following speaker, who is a counselor, Professor Dr. Augusta Elizabeth, who is going to speak on the reducing the risks and the emerging and re-emerging zoonotic epidemic and the pandemics. So I hand it over to Ms. Sandhya Balaji to welcome Dr. Augusta before us. Thank you so much.
Yeah, thank you, Dr. Srividhya. As Dr. Srividhya mentioned, we are going to talk about reducing the risks of emerging and re-emerging zoonotic epidemics and pandemics. So zoonotic diseases are those which are transmitted from an animal to another animal or human through a bite or any kind of communication, or like to be touched or to be bitten. One of the most common that we've all heard about is probably rabies and cat scratch disease. And some of them are fatal and do not have any kind of treatment. So to safeguard against these emerging and re-emerging zoonotic epidemics and pandemics is very necessary as per the One Health Quadripartite, so that we can look at a sustainable environment where not only good health and well-being is put into consideration, but also we look at supporting the SDG 13, which is the climate action, as a balanced ecosystem, helps prevent the proliferation of these zoonotic diseases through environmental changes. So with us to talk about this, we have with us Counselor Professor Dr. Augusta Elizabeth, who is a Master's in Public Health and is associated with St. Werburgh Parish Council. She's also the Director of Health Promotion Education at European Sickle Cell Federation. She's the CEO of Sickle Cell Intervention and also the CEO of African Sickle Cell Center for Education and Research, Gambia, Sierra Leone as well. And she's also associated with Anglia Ruskin University Medway Council, Rochester, England. And we welcome you, ma'am, to this evening to express your inputs on this pointer.
Thank you so much. Can you hear me?
Dr.
Yes,
Augusta,
Okay.
yes.
Hello, everybody. Thank you so much for this warm welcome. It's a pleasure of being here with you all the way from the UK. A great day, a great afternoon. Welcome to all distinguished speakers. You know, you're all important in all our eyes and the eyes of the people that are watching you today. Yes, today I'm going to speak about reducing the risk of emerging and re-emerging zoonotics, epidemics, and pandemics. I'll start with my introduction first. You know, for some of you that doesn't know, emerging infections, diseases are diseases of infection origin whose incidence in humans has increased within the past decades, or threatens to increase in the near future. The reappearance of previously known infection after a period of disappearance or decline in incidence is known as re-emergence. So what are the emerging disease that we are going to look, we're going to talk about today, or we're going to look at today. Today, that will be including the emerging diseases include coronavirus, COVID-19, which all of us know, that, it brought a standstill to the whole wild world. SARS, infections, Lyme disease, E. coli, dengue fever, West Nile virus, Zika virus. And what are the reemerging diseases that includes? The reemerging disease includes malaria, tuberculosis, cholera, pertussis, influenza, pneumococcal disease, gonorrhea. So despite dramatic progress in the treatment and prevention, infections diseases are still of enormous global significance with tremendous economic and political implications. Emerging and re-emerging infectious diseases, as well as emerging antimicrobial resistance, are major challenges to all countries worldwide. For the most importance to counteract the imbalance between the industrialized world, new economics, and developing countries, and to adequately and timely react to new threats on a global scale. So what are we talking about here? Preparedness. Have you heard of preparedness in public health? Preparedness. Preparedness not only means surveillance and planning, but also has to include the provision of facilities to adequately treat and, if necessary, to isolate patients with infectious diseases of public health importance and relevant epidemic potential, and also a risk of transmission to other persons, including healthcare workers. Take forces and high contaminated facilities for both laboratory diagnostics, services, and treatments of patients using barrier nursing have been set up in several countries. However, all health facilities of a certain level, such as general hospital, should be prepared by the organization and structure to treat patients with infections of public health relevance, such as multi-transistent in TB under appropriate isolation, barriers, nursing conditions. This also applies to hospitals in resource-poor countries, adequate training of healthcare workers and strict management have been effective to control outbreaks of highly contagious infections, with rural and hospitals lacking sophisticated techniques and equipment, which the CDSE established as well. So what are the strategies for control and prevention may be quite different for various emerging infections. Effective vaccinations are available only for some infections and are usually lack for newly emerging infections. For the majority of emerging infections, control and prevention have to rely on information, education, exposure, prophylaxis, interruption of transmission by vector control and control of reservoir host, which is the rodents, and case finding with early diagnosis and treatments here. So how should one be protected from these re-emerging diseases? You need to protect yourself. Handle and prepare food safely. Food carry germs. So it's so important to invest. We prepare food every day in our kitchens. So I will tell you now that it's really important to invest food hygiene in your kitchen, wherever you are, that you can handle food. Wash your hands often. We know what this COVID means to us when we had to wash our hands, even having flu. At home, you need to wash your hands. Using the toilet, you need to wash your hands after that. So it's a good practice. Learn how to clean hands and help prevent flu. Clean and disinfect commonly used surfaces. Our surfaces that we use every day. We need to have that we need to embed that in our minds, in all areas of our lives, really, whether we are in the offices, whether we are in our homes, really. So germs can live on surfaces, cough and sneeze into your sleeve. So don't share personal items at all. Get vaccinated, avoid touching wild animals, stay home when you are sick. So what are the risk factors for the increase in emerging and re-emerging infectious diseases? Factors that have contributed to these changes are population growth, migration from rural areas to cities, international air travel, poverty, wars, and destructive ecological changes due to economic development and land use. What are 3 universal precautions to protect against the spread of disease? As I've said, hand hygiene. Hand hygiene is the most important measure to prevent the spread of infections amongst patients. Respiratory hygiene, cough etiquettes, sharp safety, safe injections, practices, sterilization and disinfection of patient care items and devices is so important. Environmental infection prevention and control. So what can be done to address the problem of emerging diseases? Public health policy and practice that combine investment in surveillance, laboratory research and training, epidemiologic investigations with prevention control will reduce the impact of emerging infectious disease threats in terms of both human suffering and economic losses. I have 3 main factors here that contribute to emergencies and re-emergence of infectious diseases. So these include ecological, environmental, demographic factors that place people at increased contact with a previously unfamiliar microbe or its natural host or promote dissemination. And one of the ways that you can help really, have you ever wondered when you travel to check, before you travel in a particular country, to check the health implications? Can anybody here listening to me testify this, or can say something, or raise an emoji or something on Facebook or anywhere if you can hear my voice? Have you ever take time to read about the health implications before you travel to a country? So how can travelers reduce the risk from infectious diseases? Travel abroad doesn't need to result in an illness from infectious diseases. Taking these steps can help reduce the risk. As I'm rightly saying this here, because I travel a lot. And when I travel, I make sure that I check on, the various health challenges in the country before ever I visit that country. Get travel health information as far before your trip as possible. Do this even if you have been to the destination in the past. Sometimes things changes really. Health conditions can change quickly in some parts of the world. Learn about, we have climate change and it's interfering in every day of our lives. So health condition can change quickly in some parts of the world. Learn about special risks for children, pregnant women, people with chronic diseases, and people with weak immune system who might be traveling with you as well. So for specific advice, see a travel medicine specialist or a healthcare provider who knows the area you will visit. Do this at least 4 to 6 weeks before your trip. If you're pregnant or plan to meet to get pregnant, ask a travel medicine specialist about pregnancy, health risks in your travel areas. Make sure your routine vaccination are up to date. So this includes the yearly flu vaccine. Get the vaccine and take the prevention medicines advised by your healthcare providers, your GP practices. You may need some of these weeks before travel. Contact your healthcare provider as soon as you have travel plans. So it's so important. So this will help make sure that the vaccines, medicines to help you, gain way ahead of what you'll be doing. If you need to take medicines to prevent malaria, for example, take it as prescribed. It's so important. Follow dosage instructions carefully. Medicines to prevent malaria must be started before your trip. So this is to make sure that there's enough medicine in your body before you have contacted with mosquitoes at your destination. Put together a travel first aid kit. It should have items targeted for where you'll be traveling to. Add enough extra medicines, suppliers. Don't just say, oh, I'm just going for 2 weeks. I will take 2 weeks medication. No, there can be different, circumstances that will pop along. You never know, maybe your trip can be delayed. So at least plan your trip. Your healthcare provider can help you figure out what should be in your kit. So bring personal protective equipment, which you use to prevent COVID-19 throughout your travel by using mask or something. You can do that as well. So this includes at least mask, alcohol-based hand sanitization, because sometimes you're busy traveling, you can't even go to the toilet or whatever to have your hands washed, or you can go to the plane and do that. But the easiest way you can do is to get the alcohol-based hand sanitization in your bag. You can have the little size one. So depending on the level of potential exposure, you may also want to bring on an eye shield or goggles. I use the goggles. So a personal respiration, medical gloves and protective gowns you can use as well. So before you leave home, research, educate yourself how emergency medical care is done where you're going. Find out about medical evacuation services that are available, in the area you're going to in case you're sick. So contact your health insurance plan. Ask them what is covered in other countries. Take 2 copies of your medical insurance information with you. Keep each copy in a separate place. So if you're traveling as part of an organized tour, or ask the tour company what medical services are available on the trip. So ask if they offer additional travel health insurance. So it's so important. So if you have symptoms of illness when you get home, contact your health provider right away. Tell them where you have been to and what you've traveled to. This may include fever, rash, joint pain, diarrhea, belly pain, or red eyes, or you may have other symptoms. So for diseases and outbreak caused by infections of public health relevance that are transferable from person to person, contaminated procedures including isolation and treatment of patients under control of barrier nursing, as well as tracking and surveillance of contacts warranted by national and international health regulations. In conclusion, public health measures to prevent infectious disease: safer water, sewage treatments and disposal, food safety programs, animal control programs, vaccination programs, public health organization. 3 areas of global intervention that you have to listen to me today that I speak. Improve global coordination and leadership, so important. Provide a sound financial footing for pandemics preparedness and response. Invest in the gaps of infrastructures to monitor and to respond to threats. Improve global coordination and leadership. Collaboration is so very important in our leadership styles. The mechanism to mobilize global funding for these crucial tools are limited, leaving every country in our interconnected world vulnerable. That is so true. The world did not have the right infrastructure in place to respond to COVID-19. And so it could have been act as a speed to contain the initial outbreak. So to prevent pandemics, we need to invest in 3 areas, like I've said: surveillance, manufacturing, and coordinated research and development. Research and development for diseases that are at risk of becoming the next pandemic. Continue to fight the COVID-19 pandemic doesn't lower the chance of another health threat at all. Research suggested that epidemiologic surveillance and investigations to characterize the disease transmission to prevention through contaminated and control measures, development and deployment of medical countermeasures and emergency information and warning. It's so important. And in the UK, I remember I wrote a book on bioterrorism a few years back. So I communicated in terms of bioterrorism, the significance of communication in bioterrorism. Communication plays a pivotal role in preparedness of emergency situation in bioterrorism. Bioterrorism needs a lot of effective and collaboration in the community. Recognize all anthrax epidemics that arise within a short time frame can be done in various ways, such as surveillance, flights, and public intervention. So today, I'll leave this for you to look through, for you to think about what have been said today, for you to practice in your community, for you to take charge, and all government bodies need to come together to collaborate, to heads off together, to collaborate in one accord, to think that we are all in this together in the whole wide world. Because when we know these epidemics and these pandemics affects us in all countries, we really need to put things in place for sustainability in the near future. Thank you so much for listening to me today. A very good afternoon from the United Kingdom, Chancellor, Professor Dr. Augusta Elizabeth Koroma. Thank you so much.
Thank you. Thank you so much, Dr. Elizabeth. Thank you for your amazing speech. Thank you for giving us all about reducing the risks of emerging and re-emerging zoonotic epidemics and pandemics. I'm sure now that if we decide to travel somewhere, that we will really check what is happening in that country, because that is very important. Taking care about health hygiene, taking all your advices, having on the mind. We are really blessed, Dr. Elizabeth, that we have you, because we know that in any time we can contact you, we can ask for help. You are the best in this field. So honored, grateful, humbled, blessed today. Thank you. Thank you so much for being with us again. It is always our pleasure, and our audience, dear audience, please listen this again, because if we want to protect our health, this is really, really important. Thank you. Thank you, Dr. Elizabeth.
Thank you, Professor Nada. It's a welcome.
Thank you so much for every time when we invite you, you join us and bring us new knowledge, especially in the field, what is for us the most important thing. Thank you.
It's a great pleasure in sharing my knowledge. That's why I'm a specialist. So thank you so much.
Yes, and I want to say something more for our great Dr. Elizabeth. She's not only in this field, she's a great entrepreneur. She's a great leader. And yes, for girls who decide to have a wedding, she can bring you a beautiful, beautiful wedding dress. So if you are dreaming about your wedding dress, contact our great Dr. Elizabeth. You will get it. You will get it from her. Thank you.
Thank you so much, Nada. Thank you, Professor.
Now, moving from United Kingdom, we are still in Europe. We are still in Europe and going to one of the most beautiful countries. Dr. Elizabeth, this time you were in Italy and you missed Croatia. You were there nearby us. So, so we are moving to Croatia and in one of the most beautiful part of Croatia, where we have a great educator. She is Professor Sanja Zrilic. She is coming from a beautiful town, Osijek. She graduated there. She has a master's degree in economic and work as a professor advisor. She is promoted first as a mentor, then as an advisor. She's awarded as one of the best teachers in Croatia with the recognition of Ministry of Science Education. Also 2022, she got a global award for excellence in recognition of the commendable achievements, contributions to the service of humanity, recognition of achievements and continuous excellence in education as an innovative educator in 2022, now outstanding teacher 2023 by the International Organization 21st DG Skills. She's writing so many articles, professional articles. She's an author in the magazine STEMology, doing educational research. She's conducting about the environment in her region. She's an initiator of so many projects called modernization. She's working for the curriculum, in the curriculum of the training companies who were holding the school project. More than 100, she got a project more than 120,000 euros. Participants of other strong projects, European projects on the e-twinning platforms, giving lecture, doing so many meetings at the international level as well as the national and European. So mentoring the students in the competitions, doing for the freedom. You know, we can talk. We in Croatia really have amazing educators. We are on the top level in the Europe. I'm proud on all the educators in my country because all are doing great. We are really we are giving everything. Our mission is education, and we are really doing that. So welcome there, Sanja. Enlighten us today. Our Sanja has a topic, the global upsurge of food and water safety hazards. Welcome, Sanja.
Well, thank you for this great warm welcome, my dear colleague, Professor Nada. This is really great opportunity for me to be in such a great circle of people with great knowledge. I want to share my screen if it is possible.
Okay, if you can put a full screen, Sanja. Great, great.
Is this okay? Okay.
Yes, great.
So my topic today is the global upsurge of food and water safety hazards. Why I choose this topic? Because of global upsurge of food and water safety hazards, there is increasing challenges and concerns related to the safety of the food and water supply in various parts of the world. There is several factors contribute to this phenomenon. First of all, rapid urbanization and population growth. As the world's population continues to grow and more people move to urban areas, the demand for food and water increases. This constrains existing infrastructure, leading to inadequate sanitation and hygiene practices, which in turn can result in food and water contamination. Second factor is globalization of food supply chains. The interconnectedness of the global food supply chains can lead to the rapid spread of foodborne illnesses. Contaminated food products can quickly reach different parts of the world, making it challenging to identify and contain outbreaks. Then there is, of course, climate change. Changes in climate patterns can affect food and water safety. Extreme weather events such as floods, droughts, and heat waves can disrupt agricultural production, contaminate water sources, and compromise the safety of stored food. Of course, there is also antibiotic resistance. The misuse and overuse of antibiotics in both human medicine and agriculture have contributed to the rise of antibiotic-resistant bacteria. These bacteria can contaminate food and water sources, posing a significant health risk to consumer. Also, there is unregulated and informal food markets. In many regions, informal food markets operate without adequate oversight and regulation. This also can lead to the sale of unsafe and adulterated food product, putting consumers at risk. Lack of infrastructure and resources is also a factor because of in certain parts of the world, this inadequate infrastructure, lack of clean water sources, and limited access to proper sanitation facilities. It can contribute to food and water contamination. Inadequate food safety regulations and enforcement also affects this topic. A weak or poorly enforced food safety regulation can lead to substandard practices in food production, processing, and distribution. To address these challenges and ensure food and water safety, governments, international organizations, and other stakeholders have been working on various initiatives, including strengthening food safety regulation and enforcement mechanism is one of the most important initiatives. Then there is promoting good agricultural and hygiene practices. It's also very important. Then there is investing in infrastructure for clean water supply and sanitation. Then enhancing international cooperation and information sharing to detect and respond to foodborne disease and outbreaks. And at last, there is raising public awareness about food and water safety. It's important to stay informed about ongoing developments in food and water safety, as these issues can have significant implications for public health and well-being. I want to emphasize United Nations Sustainable Development Goals, which affects this topic. First of all, there is Sustainable Development Goal 6, clean water and sanitation. There has been made some progress in increasing access to clean drinking water and sanitation, but still billions of people, mostly in rural areas, lack these basic services. Statistics show that 1 in 3 people do not have access to safe drinking water, and 2 out of 5 people do not have a basic hand washing facility. And we all heard how important is this. Hygiene is also very important. The COVID-19 pandemic has demonstrated the critical importance of sanitation, hygiene, and adequate access to clean water for preventing and containing the disease. Hand hygiene saves lives. Hand washing is one of the most effective actions you can take to prevent infection. Yet billions of people still lack safe water sanitation. Sustainable Development Goal is to ensure access to safe water sources and sanitation for all, because access to water sanitation and hygiene is a basic human right. Second Sustainable Development Goal, which is related to this topic, is second Sustainable Development Goal, Zero Hunger. It is about creating a world free of hunger by 2030. The number of people going hungry and suffering from food insecurity had been rising between 2014 and the onset of the COVID-19 pandemic. As we all know, the COVID-19 crisis has pushed those rising the rates even higher, and has also exacerbated all forms of malnutrition, particularly in children. The war in Ukraine is further disrupting global food supply chains and creating the biggest global food crisis since Second World War. Why is this topic important for all of us? First of all, because of public health impact. Contaminated food and water can lead to widespread outbreaks of illnesses, including foodborne diseases such as gastroenteritis, cholera, and salmonellosis. Then, second, there is economic consequences. Foodborne disease outbreaks can lead to reduced productivity, increased healthcare costs, and loss of income due to illness, affecting both individuals and entire communities. Then there is a global trade and travel. In the interconnected world, contaminated food and water spread quickly across borders through international trade and travel. Environmental sustainability also is important because contaminated water sources can have detrimental effects on aquatic ecosystem and wildlife. Consumer confidence also. Ensuring food and water safety is essential for maintaining consumer trust and confidence in the food industry. And I want to conclude this topic. Given these compelled reasons, governments, international organizations, and stakeholders around the world are focused on improving food and water safety through comprehensive strategies, regulations, and collaborative efforts. By addressing food and water safety hazards, societies can better protect public health, promote sustainable development, and contribute to a more secure and resilient future. The global upsurge of food and water safety hazards is a critical and multi-faced challenge that affects public health, as I already said, economies, trade, and the environment on the global scale. The interconnectedness of our modern world, along with factors such as rapid urbanization, climate change, and evolving agricultural practices, has intensified the need for robust measures to ensure the safety of our food and water supply. Addressing this issue requires a collaborative and multi-pronged approach. Governments, international organizations, and private sector and individuals must work together to implement and enforce strengthened food safety regulations, promote sustainable agricultural practices, invest in clean water infrastructure, and raise awareness about safe food handling and consumption. And I will end this presentation with words of Thomas Keller. Respect for food is a respect for life, for what we are and what we do. Thank you for your attention. And thank you, Professor Nada, once again for this opportunity.
It was really amazing. It was really amazing there, Sanya. Thank you for your great presentation. There, Sandy, do you want to say, give comment to our great Sanya on this presentation?
Absolutely. It was a wonderful presentation, and she had rightly pointed out how important is safe water and safe food is, because only because of that can life evolve further. And both these are only when we're able to mitigate the causes of these contamination can we move forward for a sustainable world. And it can address many of the SDGs, including zero hunger and no poverty. And also it can call for collaborations. And it is the first step towards sustainability, and very important one. And as she rightly pointed out, the consumer safety, or the assurance to the consumer comes first in the food industry from safe water and harmless food. So it was very well presented, Dr. Sanya. It was very interesting. Thank you.
Thank you once again.
So as we move on, may I move on to the next speaker, Dr. Nada?
Yes, of course. We can move forward. We have our next speaker. She's here. You can present her.
Yes, so we are all talking about the One Health Quadripartite, and what they're trying to do is to establish the intricate link between the health of the humans, animals, plants, and also the link between the environment. So we need to find out how this link, or what this link exactly is going to do, the synchronizing is going to do, and how it is going to lead us to the sustainable world. So here we have with us Dr. Shyama Hafiz Marikar, who is an educator. She's a master in education. She's also an IAPCCT personal mastery certified international trainer. She's also a neuro-linguistic practitioner and a master and a trainer. She's a mindfulness master practitioner, and she also facilitates and motivates, and she's a dedicated teaching professional with over 8 years of experience in teaching science for multinational in private schools in Muscat, Oman. So according to her, she believes that the human brain is the most complicated and fascinating faculty which opens to endless possibilities if only one could master the art of guiding your thoughts and emotions. With that very, very positive note, let us understand from Dr. Shyama how is the interlink between the various facets of our ecosystem is going to lead us to a sustainable world. Welcome, Dr. Shyama.
Thank you very much. Thank you very much, Dr. Sandhya Sri, for that wonderful introduction. First and foremost, thank you very much, Dr. Nada, for having me here today with all these eminent speakers and great professionals.
And you are welcome. You are a professional. You're a coach, trainer,
Yes,
mentor.
yes.
Great.
Exactly. And to be part of this G20 Summit, it's my great pleasure and privilege to be here. Let me share my screen. Yes. It's from the beginning. Okay. I hope my slide is visible, right?
That's
yes.
Great.
So at this platform today, my topic is links between the health of environment in terms of humans, animals, and plants. So as a science teacher, as a mindfulness practitioner, a neuro-linguistic practitioner, this topic is really touching, close to my heart. So I'm really happy to share my knowledge and expertise on this topic. Now, yes, first let's look at human impact on the environment. What does that mean? Everyone, I'm sure everyone present here and most of the young children even know today, they are aware about human impact on the environment. We have impact our environment tremendously throughout all these years, maybe 100 years we can see. And now we are aware about the negative impacts on the environment, right? So we have done many damages. Our main purpose wasn't to damage the environment or destruct the environment, but unfortunately, we have done so many things to our environment. Like, for example, you can see the wastewater collection to the natural water resources, and some industrial waste collection to the waters, and the smoke emission from factories, and all of these kind of human negative activities have impacted the environment. So as a result of those continuous human activities, we had to face, or we are still facing, disasters or catastrophes time to time. For example, as you can see here, the fire forest recently happened, and the earthquakes, tsunami, the tornadoes, right? All these natural disasters happens due to our negative activities. It may not happen immediately, but with time, the things that we put into the environment, as Newton's third law says, every action has opposite and equal reaction, right? So what the environment does in the long term, it taking all the negative things and the positive things as well we are doing, but along with these negative things, it has to put it back to us. So many of us are aware about human impact on the environment, but how many of us are aware about the environment impact on human health? We hardly think about it, and we hardly speak about it, right? Be it in schools, institutions, we celebrate Environmental Day. We know we have the awareness. Even from the childhood, we know that we have to plant trees, and we have to do good things like stop cutting trees and deforestation against these things, making posters, and we celebrate, we plant trees, make speeches, competition, everything we do. Just we have the awareness or the knowledge about the human impact on the environment. So we feel sorry, so we take actions. But now it's time for us to educate or make everyone aware about the impact that environment has on human health. To look at this, let me share the aspects of now environment affect our health, human health, right? So what are the environmental aspects, or what are the things that elements that comes under environmental factors? For example, natural environment. As you can see, our surrounding environment, we cannot live without it, because it is the first interconnection with a human being, right? So natural environment, we use air to breathe, and water to drink, and cooking and bathing, and soil for agriculture and recreation, and everything we use the soil. So we are connected to the natural environment, and including chemical, biological, and social features of our surrounding also are the part of natural environment. So we don't have immediate control over it, but still they play a crucial role as our natural environment. So they have more impact on our health as well. And the next, our environment is man-made or built environment. Buildings where we live and we work, and the transportation systems, roads, and of course the land that we use to agriculture, to the crops and all, and then also the pollution that we make by our day-to-day lifestyle. We also invest or put into waste also into the environment. This is called man-made or built environment. And the next environment, important aspects of environment, is social environment, which means that our healthy food, diet system, and how we exercise, our lifestyle, all this includes a social environment, how well we eat, what is the food that we, the condition of the food that we consume. And then not only that, social environment means also social economic status and other social societal influences like family and friends, how they live. We always have that curiosity to know what others is doing, and we also want to do that, right? This is the way of living. So social environment is also a main part. It's also play a crucial role in our human health. And the next one is environment interacts with the person genetic makeup. And this is actually genetic makeup means that everyone is individual and they are unique because of their genetic things. And we know that though the COVID-19 post pandemic, there are people who did not get that corona. There are still, right? These, though they were living in the same environment, they were not vulnerable to this kind of diseases. That's all because they have a unique and genes makeup which can resist any environment than the others, better than the others. So these are the main aspects of environment which affect or contributes to human health. Now, what is when environmental health means exactly? What is the definition of it? We look at the definition of it. It's defined by the problems we faced. So many people think that environmental health means it is about the environment, surrounding environment and its cause and diseases. But environmental health is basically human health. So human health in the sense populations. Populations means animals and plants and human, right? Of course, all these three circles interfers into environmental health. Now, when some any diseases outbreak happens, what happens? The environmental scientists, they just get to know about this disease. They get the awareness, and then they go there and they try to investigate about that problem. So what they understood is that one population has been facing, or part of that population is facing this disease. So what is the root cause of the disease and how we can treat it? What is the next immediate action we can take? All these conditions, it depends on time to time, it changes. But this defines whatever that we put into the environment, which gives back as environmental health. So if we put good things into the environment, the environmental health will be in better condition, right? But unfortunately, we have come across with all these years, all these decades, right? We have given too much for the environment. So time to time, it never forgets to give us any diseases to any population. It could be human or our domestic pets, or could be wild animals. And these are all interconnected. And what are the aspects of environment? So most importantly, chemicals. Chemicals has become a very important part in our life, because our life, today's modern life, we need things to be done in very sophisticated way and very new and very easy, simple methods, right? So the chemicals help us to solve many problems. So these chemicals, they could change, or they could immediately give good results for us, but in long term, the chemicals deposit in water, or maybe in our body, or any crops, animals, may change into a environmental health threat. It could be the risk factor. And the pest, surprisingly, we don't take it as a big issue, but even in the indoors, we can see the pest, right? The pest has a very crucial role in passing this, causing diseases. So they also play a crucial role. And then infectious diseases, like as our eminent speakers mentioned, that we have gone through different Ebola and many these things, malaria and COVID, right? All these things also have the power to take over the public health. So they can be a part of. And radiation means the natural radiation. Excuse me.
Dr. Srividhya, please continue. I muted all. Apologize. Dr. Srividhya, unmute yourself, please.
Dr. Shyama, may I request you to unmute, please?
You're muted. Sorry.
So,
You are muted in between, please.
so environmental health, in the sense that it is defined by the problems that we face, the public health. It could be animal health, human health, or a plant health. So time to time, as we have already deposited our effect to the environment, so it's time for environment to reflect on our effect, right? Negative. So as a result of it, we experience diseases, right? Or the public health, or some, we can say that so one kind of population get affected by certain disease. So at that time, what does this environmental scientist do? They go there and they investigate, they try to change the condition, right? So at that time, that will be the public health, that is the most important thing, that it threatens the whole, not only that a certain population, it could threaten all the animals, humans, and also the plants as well. So, and other aspects of environment would be chemicals that we use every day, and the pest, infectious diseases, such as COVID-19 and malaria. All these infectious diseases also can cause, not only for one population, the rest of the surrounding, other animal, from animal to human, human to animal, also it can be transmitted and it will affect. At the same time, radiation also is a part of, it causes like cancer diseases, radiations from the sun, and inside also sometimes we use different devices, machineries. From that, the radiations can cause our genes mutations, right? From that also we may get chronic diseases. And of course, noise is also the it threats if it is too much, it's too loud, and it could be the factor for our public health or environmental health. And the temperature, most importantly, if you take that aquatic ecosystem, if the environment, the temperature, water temperature increases, so that the not only the water temperature and the plants will be affected, and also the all animals or the aquatic animals will be affected due to the temperature, so that it could cause problem in them, right? So this is what we say environmental health, in the sense that the public health or the animal or the plants, that time to time they get these diseases, it can cause tremendous problem in the other, like human or a human or a population loss or economical loss. Also, it can influence in that way. And moving on, most importantly, all these we looked at the chemicals and the radiations and things like food, even from the crops also we get, right? So all these happens because of the toxins. So toxins is the terminology that we can use when things get into our body or for any other living organisms. If it is get overly or overdose, then our health might prone to any diseases. So here you can see some scientists or people who have contributed to demonstrate the links between animal and human health, the microbiologists and all the many people like Hippocrates, Edward Jenner, and Lois Pasteur. All these people have contributed to the to illustrate or demonstrate the link between animal and plant and human health. Most importantly, in 15th century, that one scientist, Paracelsus, he mentioned that all substances are poisons. There is none which is not a poison. The right dose of differentiate a poison. So which means everything, this is rightly said. So a right amount of everything, even the food that we consume, sometimes turn into a toxin. right? So right amount of everything, or the dose is important in especially taking any dosage. Medicine it could be, or the chemicals we put for the crops could be. Dose is most important thing. And toxicologists study poisons. Any substance that causes a harmful effect to living organism is called as a poison. So toxins and poisons are same. What differentiates them is the amount that we take. So here, let's look at now how this toxin accumulate to human and public health. We live in a chemical world. I am sure all of you will agree that, right? Because we are very fast world we are living in today. We need everything to be in hand. So more than 70,000 potentially toxic chemicals are produced and dispersed in, this data is only in America. So just imagine all over the world, how much toxic chemicals would be produced daily. We produce these for the, just to make some pharmaceutical changes, or we say the pesticides, right, for the betterment of things, but it could change into, turn into negative effect as well. Chemicals have many effects, contribute to atmospheric change. You know that if you take the air, too much carbon dioxide, right, it goes to the, it is the main reason for the global warming. And also, you know, the some methane, chlorofluorocarbon, all these things kind of gases, just they goes up and they make the ozone depletion, and they help this trap the heat trap in the atmosphere of the world. So all these things, chemicals have more power or more contribution towards this human health, and contaminate surface and ground. For example, we all use many factory waste, you can see. We use, and then what they do, they just discharge into surface groundwater, right? It could go there and it could spoil the soil quality, so that the farmers or agriculture, they cannot produce healthy food, healthy crops. And also, these chemicals has the power to affect species balances and natural cycles in ecosystems. For example, like minor or subtle changes in the genetics, and this can be taking taking too much of these chemicals could change in the genetical aspects, and then it could change the variation in the species, so that it could affect the cycles in the ecosystem as well. And the beauty is the chemicals are, most of the chemicals that we use are mimic hormones. That means they are same as they are produced that much quality, that natural hormones level. So they are, they have the function and the production to that level. So when one or two things goes wrong, it also can equally have the negative impact on our health, and causes mutations in genes and affect the nervous system, and people can prone to Parkinson's and Alzheimer's diseases. All these diseases caused of because of the affecting the nervous system, right? So the chemicals play the crucial role in public health or environmental health. And next one, gene variations affect, yes, gene also. We know that we have two threads of genes, which one is from mother and one is for the father, right? But these two has small genes also. There are millions of trillions of genes are there. If there is any small slight change in these genes, is what we call is a mutation. So it could produce a different organism or a different species if it goes to worse condition, or sometimes it could make up accumulate, and it may make up toxin accumulation can come. So all these environment can trigger disease development. It's also depend on the factors, age and gender also play a crucial role. And we know that small children and elderly people are more vulnerable to the diseases, right? They are prone to get all the, even for the slightest things that they get easily affected. So age and gender, these things we have to take into account. And Parkinson's diseases is an example for gene mutations, and some way environmental agents cause mutations that affect cells' functions. For example, chemicals, radiation, and infectious agents like different organs with different organisms, we can say. For example, malaria is transmitted by the mosquitoes, but it is actually the pathogens or the cause, it is a parasite, right? So in this way, agents, they transmit from one to one. They can also be affected by the gene variations. So environmental agents also can affect the activity of genes or gene expression in whole. So all these gene variations can be affected by the chemicals accumulation in their organism's body, or in human, we can say, or animals or plants. So they play a crucial role in public health, environmental health. Now, as our speakers mentioned earlier, emerging and re-emerging infections. So 70% of them are what? Vector-borne or a zoonotic, which means that if you look at the infectious or this zoonotic diseases, their root cause would be the animal. They rise from first arise in animals and then transmitted to the humans. So what is here, what's the dangerous part is, some animals, they transmit directly to the human, and human go through some conditions, that disease conditions, the public health become is affected. And then what happens is, this disease can go to the animal again, by contraction again to the animal. And what they did, these pathogens or zoonotic things, they amplify in their body, and then again they come back to humans. So this is the very difficult part to understand, as well as, you know, that we cannot avoid animals, right? Not only the public, when it comes to public health or human health, animal also get affected, because we have interaction with the animals day-to-day basis, right? Be it domestic animals or be it wild animals, whatever it is, we have the connection with them. We human beings have a connection with them. So these animals play as a intermediate transmitter, sometimes intermediate host. Sometimes what they do, they develop that, take that diseases and they amplify it, develop into new thing, and again transmit back to the human species. So this is very critical thing. This is why it's very hard to control this epidemic, pandemic type of these things. They very fast, they contract through people and children, and country-wise, region-wise, and the country-wise, and also the global-wise. So this is the very crucial part of human health. We have to study, environmental scientists, they are already doing it, and this to understand and stop this interference of transmission of this pathogens should be stopped, or should be studied thoroughly to bring a better health for us. So all this, most of these, we can say, most of these outbreaks of infectious diseases first observed in or rise in animals. So this, because this picture you can see not only the animals and the vector species like pests, cockroaches, even bugs, dust mites, all can contribute to this circle. So this is the circle, this is the connection. The public, we can say that health-wise, health connection, which keep on coming, emerging and re-emerging, right? So this is also the crucial part of environmental health. And so when we look at all these things, we have to come up to the conclusion now that One Health is important. One Health in the sense, like not only the environment itself, like soil, water, air, chemical, biological, physical, and social factors. It also important, we have to look at the animal and human also. Now, not only these things are important, and other factors that determines the human and animal health are population, fast-growing population. And also they migrate to new places from rural to, so they become congested, right? So the chances are what happened as a result, more people live in close contact with wild and domestic animals. Close contact provides more opportunity for diseases to pass between people and animals. So first reason is, apart from the environment, the rapid growth of human population is another factor that impacts the negative impact on our environmental health. And also the Earth has experienced changes in climate. And you all know that climatic changes these decades especially. It's we experience, like every day we can see the extreme heat, extreme cold, or some of the other natural catastrophes we go through. All these things happens because of the deforestation that we did long years ago, and the intensive farming practices. Nowadays, everything is farm, all people need industrialized, we can see, right? So that everything is more now. People also, population is increased in human, and as well as we can say farm animals. So disruptions in environmental conditions and habitats provide new opportunity disease to past animals. Yes, adverse climatic or weather changes also give an opportunity for these pathogens or the infectious diseases. The environmental system, ecosystem get disrupted, so that they get an opportunity to create diseases, right? Affect that system, ecosystem. And also international travel and trade have increased. You know that world is already a small world. So it has become more smaller now because we can travel easily wherever we want. Within, if you think today, tomorrow you can travel. Such a convenient world has now become convenient, isn't it? So as a result of that, what happened? The diseases also can spread quickly across the globe. As very beautifully one speaker mentioned, that when you travel, just check your profile, health profile, how fit you are, and check the other country profile, right? So these things also important part of things become easy, so that pathogens or the infectious diseases or the things that harm the environment also become faster, quicker. Now, what is the conclusion for this? One Health is the conclusion, which means human, plants, and animals. These three aspects or three important elements of the ecosystem should be treated equally. How we can treat equally? First, let's take with the human. Provide basic health advice and select primary care health and conditions. Many of us, we don't know the things. People don't know the things, even the educated people. So we have to advise them about the basic health advice and promote early detection. If some outbreak happens, we have to be aware about it, right? Human endemic, maybe in this specific region of the world, or maybe the epidemic, right? These things, threats, you have to promote early detection. What else we can do? Document water and food sources and food storage, preparation, and identity overlap with animal and plant health. So document water and food, because we and organisms, animal, plants, all depend on this water, right? So clean water and food sources for animal, and not only for them, for us. So quality food is important to maintain the quality life. So we have to have a document the water, food sources, and collect information. Household levels, sewage disposal, and human animal crop waste, everything. The information should be collected, it should be documented, it should be analyzed, right? So, and then document the pesticides and potential environmental toxins. As I mentioned earlier, toxins are the most important thing which contributes to the environmental health. So toxins also should be tracked and collect data to identify healthcare gaps between human, animal, and plant crop health. So these things can be done. Same thing can be done to our plants also. Most importantly, we have to understand the agricultural practices when it comes to plants, water usage and plant storage and crops, and establish symptoms for early identification of plant and crops. And plant and also can get disease, right? This is we don't talk much these things, but what we do is we usually use pesticides for that, so that it doesn't come to much picture in the worldwide news. But it is also go through some influence due to the effect of environment, right? So these things should be tracked, documented, and so that we can identify the pathogens, infestations, growth disorders in crops, and provide, and all the speakers here mentioned that, yes, geo-linked community is most important, based mapping of common agricultural problems to enable early detection interventions. So early detection is one thing, and then prevention is one thing. And another thing's important thing is future, it might get, as I mentioned earlier, it can come in another form of that, right? Genes get mutated, the pathogens even, and they bring another outbreak of that. So this can be avoided if all these three parts of environmentalists and human health doctors and veterinarians like animal health people, if they all come together to discuss more, to analyze more, right? And we can improve overall health of animal. And what specials we have to do for the animal? Most importantly, the same thing, geological link, community-based mapping we need, and then re-imaging and emerging animal pathogen and disease threats should be identified timely. That is most important, and improve food security and monitor foodborne illness and reduce inappropriate antibiotic use. Yes, as Dr. earlier mentioned, inappropriate antibiotic use, that we have to educate the public, right, about the antibiotic and the dosage, because they have a tremendous effect on their public health. And integrate animal plant problem, disease problem at the data output and collection level. So collection should be there. There should be more accumulation of data. Not only that, and the people from this different field, this human doctors and plant environmentalists and animal veterinarians, all these people should come together and work together to first predict the diseases and prevent it, the surveillance system, right? They have to discuss and bring it, and policies they have to make. All these things, when they do together, we can, then only we can solve the environmental for the future generation, give them the better future. Because all these days we had the environment problem, right? Now environmental health problem, which means the public health is affected, and it is an alarming time now. I think that we have to have that awareness, and to even the school level and even the adults levels, all we have to acknowledge or educate people, create awareness about simple hygiene even can be a very effective method to prevent these things, right? We can, whenever we touch the animals, even domestic or wild animals, we should get in the habit of washing our hands, sanitize our hands, right? Simple things we can educate the people. And for most importantly, this concept should be addressed in all age level of people in different way, maybe in schools, and the campaign we can have for adults and elderly people differently, so that people will take proper actions, right? And that will help to create a better world tomorrow. Thank you very much. Over to you, Dr. Srividhya.
Thank you so much, Dr. Shiyama Madikar. I have to say that I wanted to talk a little bit about what you just said, because we've heard wonderful speakers, very, very important topics, but yours particularly is the relationship between people, animals, nature, planet, and how delicate that is, right? And how we can impact it if we really look into it. So I really loved what you brought, because there's so much information, but as global citizens, it is our responsibility. And you just said something very useful. It's washing your hands. You know, it's things that we've learned since we were small, but we don't really think, and obviously it's not simple all the time, but also as global citizens, we need to advance policies and programs that are going to help us reduce the chemicals in our environment. I know they were brought on maybe to help us, but we've realized that now we have to do something to address those effects. So I really love this, because it just talks about our responsibility and how we can definitely impact. Maybe sometimes not doing something huge, but doing something consistently. So thank you so much for bringing the information to us.
Thank you very much. Thanks a lot for the opportunity.
Thank you, Dr. Virginia. Thank you so much. And thank you, Dr. Shyama, for the outstanding presentation. Well, connecting it to G20 objectives, we all know that economic development has had led to the substantial improvements in the well-being of many humans globally, but often at the expense of the ecosystems, a healthy environment, and the welfare of the animals. And with all these problems, with the global human population projected to reach 8 billion in the year 2023, amidst the unsustainable consumption and the production patterns, the pressures on maintaining our natural systems are tremendous and will continue to grow. Well, to maintain the earth eco-friendly, natural resources are being used at a faster rate, as you rightly mentioned, that they can be replenished due to the unsustainable and destructive practices with insufficient consideration for biodiversity or the health surrounding ecosystems upon which our lives are well depend upon. So we should take care of the land use change, unsustainable agriculture production, as you rightly mentioned, and intensification on the large-scale deforestation. It all started with the deforestation, the land degradation, as you rightly said, and the biodiversity loss among the drivers, or the threatening ecosystems, which totally integratedly functions and posing an increased health risks upon the beautiful Venn diagram union of the people, planet, and the animals that you mentioned, with the integration, with the intersection of the interface with disproportionately affecting the vulnerable communities. So these risks will be taken into consideration definitely, as expanding urbanization, as you rightly mentioned, unsustainable food production, and the consumption patterns beautifully explained over through the process that you during your session, which including the increasing the complex food chains that you showed with the humans, animals, the plants, and the consumables, poor wastage management and the disposable, with increased trade and travel. You didn't miss any point, ma'am. Hats off to you. Thank you so much. As well as the pollution and the biodiversity and the climate crises. It was definitely a brilliant presentation. Thank you so much, Dr. Shaima. Wonderful it was. Thank you so much.
Thank you very much, ma'am.
Over to Dr. Nada, please.
I want to also thanks to our great Dr. Shyama, really amazing presentation. What to say, giving us all this from the side of science, from everything in each detail. Dr. Shyama Oman is really blessed with you. We today also at the IIU page, IIU stage, really blessed to have you with us on this G20. We really want you to come back to give us some training sessions, because this is very necessary to share on the global level, giving education to our youth. Yesterday was International Youth Day. we are working all for the bright future for our youth. So thank you once again.
Exactly, exactly.
So
I will
much.
definitely join again. Yes.
Yes, thank you so much. Let us move. Let us move forward. Now, we will invite our next guest, Dr. Sahid Adibesi, on the topic integrating the environment into One Health. So, Dr. Sandy, please, would you introduce our great next esteemed guest speaker?
Definitely, with pleasure. Uh, Before I introduce our speaker, a small hint about the pointer. So Dr. Shyama rightly pointed out the interlink with the various elements in our environment. So to safeguard our planet's health for the current and the future generation, we need to integrate the environment into the One Health. And to speak about that, we have with us Ambassador Dr. Shahid Adebisi, who is an accomplished research scientist, a sensational teacher, an author, a prolific writer, and he manages creative resources and he passionately advocates global sustainability. And his projects focus on promoting sustainability and healthy living. And he's a doctorate in plant genetics. And so his projects also focus on plants genetics and biodiversity conservation. And he's committed to finding innovative ways to combat climate change and support the ecosystem sustainability and promote a healthy planet. He's also a lecturer at the Ocean State University, and he's engaged and involved in the activities that inspire future sustainability leaders while also fostering cross-disciplinary collaboration and knowledge sharing among stakeholders. As a global ambassador for sustainability promotion, collaboration and research with sustainability promoters and sustainability collaborators, SPSC UK, and by extension, a research global chair with the Global Sustainability Futures Network, GSFN UK, which is one of our partners here. And he's the former country manager to the United Nations Sustainable Development Solutions Network and the founder of Scholar Media. And he promotes green medicine and rare discuss sustainability, lifestyle matters, and sustainable living in research, networking, and book authoring, and other book authoring for sustainability solutions. We welcome you, Ambassador Dr. Adebisi, and look forward to hearing your inputs on integrating the environment into One Health. Welcome once again.
Thank you so much, and I want to especially thank the organizer and the invite the doctor that actually invited me, and also for giving me the opportunity to meet these very great minds to discuss and also share my perspective on that very important topic, integrating the environment into One Health. And I will quickly share my slide and also run through the thoughts that I put together. And of course, like every other members of the discussing panel have discussed, I will talk from experience, and also what I put together is also from experience, and also from my journey through the nature, and also seeing what people are actually doing to the environment, and how the science that I learned and I training as a inspire me to see how we can bring up the solution to actually address this issue. So I hope my slides are feasible.
Yes, you are audible and your slides are visible. Welcome.
Yes.
Wonderful, wonderful, wonderful. So I start by saying that the One Health, which is the focus of this very discussion, it recognizes human, animals, and environment. And of course, it is about the interconnection and interdependence. And the overall goal of this very One Health is actually to optimize health for all, and also see how different disciplines and experts can collaborate. And when I studied the concept of One Health, I saw that there are few missing specialties or expertise or area of focuses that are needed to be brought into the concept. Apart from medicine, veterinary science, environmental science, public health, there is need for bioengineering, biotechnology to actually come into the concept, because that is where the real solution is going to come in. Then it offers framework for addressing complex health issues. It has been discussed and, in fact, exhaustively discussed by our first speakers. So I will leave all this area. And also it recognizes health challenges that occur, that it is affecting one another in different ways. And it also had help in addressing so many issues that have been discussed, like pandemic, antibiotic resistance, foodborne illness, and different things. But one thing that is that are yet to be mentioned is conflicts. And actually, One Health and the issues around it are actually conflict related, and also the quality of life. These are the perspective that I thought through my thinking. And also, yes, there was this very idea that came to mind. If we can have one health, and we are talking about environment, is the environment that we are actually living in as one that is affecting everybody. It's not one environment. Then I checked that, is there any concept like one environment idea? And of course, there is. And this is telling us that the health we are living, the universe we all share with all other universal bodies, are actually one environment. And the advocates of this very one environment believe that we must work to protect and preserve the natural world as it exists. And also, if we want to secure the future for the next generation, we must do something to address the consequences of what we are experiencing now. And then I look back into this. This is a beautiful how nature actually created itself. Natural environment where we see the birds, the people happy, playing with animals, insects, microorganisms, aquatic water body, terrestrial water body, arboreal, and everything living in harmony. And also their functions make a balanced, healthier, happier, and prosperous natural environment that we are all made over 5 billion years ago. But now, look at human environment in agriculture. Look at what is happening in all this very picture. Look at human environment in local places where we live in, slums. Look at the garbage, look at the refuse, look at the waste. Look at human environment in the industrial environment. Look at it. Look at what humans are doing to the environment. Look at human environment where construction are happening. All these places in this very space are cleared up because we want to recreate something that is beautiful for us to live in. Construction, residential. Look at the environment of transportation because we want to move from one place to another. Look at how heavily we are polluting the environment. This is human environment. This is what human has turned nature into. And I summarize this very thought and this very scenario into the diverse way in which human explores, interferes, disturbs, recreates, utilizes, misuse, abuse, and manipulate the environment and its resources, have far-reaching consequences. And of course, it is not only that it is increasing the pre-existing challenges, but it is creating a new complex one, which we have been discussing ever since we started this very conversation. And of course, the planet is where we are all sharing. And the planet is, now, these are the environmental issues that we are all witnessing today. Increase in the temperature. Actually, there was this very term that is being talked about now. We were talking about heating up global warming before, but it is not changed to boiling. Look at the flooding. Look at the pandemic issues. Look at the animals suffering, extinction, biodiversity loss, land degradation. Humans are unhappy. And the children, they are suffering. That is the environmental issues we are actually looking at under One Health. And one thing that we have seen is that there are three major things that I thought through under the very environmental issue. We have the global warming and climate change. We have pollution of land, pollution of water, pollution of air, and we have habitat and biodiversity loss and impact. These are what is causing the human health, animal health, and ecosystem health challenges. Now, how do we achieve One Health through environmental health integration? That is where my presentation focus on, and that is multi-level, cross-sectoral, interdisciplinary collaboration and partnership. This is very, very key. Then the second thing that I proponed was awareness, education, and advocacy. This very awareness, education, and advocacy had a long way to go in addressing this very issue, because the population that are unaware are more than the people that we gather here, or people that are aware in the academics or research, in the research world. The magnitude or the massive people in the population that are unaware, they are the ones that are going to create a lot of challenges to addressing this issue. And that is why awareness, education, and advocacy are very, very important. Then the third one is environmental surveillance. Of course, it has been discussed. Then improving regulatory framework, the government aspect, the local leadership aspect, at different level where we have to formulate policy. Then we are fostering innovative solutions. This is where the scientists and the engineers and innovators actually need to critically look into. So in breaking them down from my own thoughts, yes, we have the people, like I say, we have the industry and we have the government. And from the people, we have the leaders, we have the households, because the leaders are leaders of the community, leaders of different districts. We have the household, the father, the mother, the people that are elderly, that are having family units, the academia. They are the leader in their own institutions. The researchers, they are the leader in the focus of finding solutions. Then the industry, we have the investors, where they need to focus their investments, where they need to focus it. The manufacturers, the mindfulness of what to manufacture in a sustainable way, the businesses, where to actually do the business, the innovators. Then the government, we have the heads of government, the policymakers, the politicians, the institutions. This is where we have the multi-level partnership and collaborations. Then the education that I talk about, we have the people, the local campaigns. If not for the local campaign or the massive campaign about the pandemic, the history will have been something else. But the local campaigns still relevant and very, very relevant in the One Health, social media, workshops, seminars, collaboration. We have the industry training of staff, training of different people that are in charge of the manufacturing and construction. Then we have collaboration, we have reward initiatives, because reward initiative is very, very important. It's very, very key in getting compliance and also cooperation from the industry. Then we have sustainability framework when they are designing their planning, then surveys and assessment to check if the industry are actually doing what is right. Then we have the government, sponsor campaign, expert consultation. What I've learned over the years with my interaction with the government people is that the majority that are into politics don't actually have the deep knowledge of what is happening in science. So they need expertise consultation. They need to get information to actually make the right decision as leaders of government. Then strategic policy, incentive programs, collaboration, then research sponsorship. Then when it comes to environmental surveillance, these have been discussed by the previous speakers, but I need to just mention them. Quality monitoring is very, very important. Pollution tracking is very, very important. Industrial hygiene, risk impact assessment. Most of the projects, most of the activities that we are actually carrying out in the environment, are we actually taking cognizance of the risk assessment of these things? Community engagement, are we really engaging our communities when we are talking about the very environmental surveillance. Government policies, epidemiology, research, these are very, very key. Then land, soil testing to detect what is happening within the soil. That is part of surveillance. What waste disposal system, like I've shown in my slide in the gallery of what is happening in our rural areas, in our industrial area, waste disposal system, land use planning. This has made our biodiversity and even the terrestrial habitats suffer a lot. We need to actually make a way to address this very land use planning. Sustainable agriculture. When I learned that agriculture actually contributes a lot to what is happening in the climate change environment, I was like, wow, what is happening? And of course, there are statistics that actually show that our agriculture is not sustainable mostly, which needed to be retract back to sustainability. Then risk impact assessment, community education, very, very important. Ecological mapping. Ecological mapping, we have to do a lot in this because different ecology has different characteristics. How certain ecological system can respond to the outbreak of disease is different because the inhabitants, the biological factors that are there are also different. We need to do a lot in this very ecological mapping. Then improving regulatory framework. These are need to do with policy, regulation, and also the different aspects that has to make people comply with whatever solution that is going to be preferred. Pollution control is very, very important. Capacity building, eco monitoring, threat detection. Threat detection is actually one of the key that I think one of our speakers has talked about. If we don't detect early, it can spread like a fire. And once it spreads, it can catch up the whole global space within short period of time. Threat detection is very, very key. Response system, how responsive mechanism are we putting in place? Innovative technology, green practices, then resources use, land use system, bioconservation, utilization efficiency, habitat protection, risk analysis is very, very key. How do we analyze our risk? There are so many projections about this very pandemic that help a lot in the response system, in the response mechanism that has really saved many lives. Then stakeholder engagement. I put this because if there are policies made without stakeholder engagement, without involving them, that is not inclusive enough. There is going to be a problem in the implementation process. So this is very, very important. Then fostering innovative solution. This is where I put my own idea up and say, okay, let's look at if we want to actually keep the head as one and maximize the well-being. What are the key innovations that we can look into? Then I put together epidemic simulator. We should design a system, a device or a machinery that is going to help us in this very epidemic simulation. Situation analysis is very, very important. Emergency signaling, very, very important. Spread prediction, transmission rate, population threats, recovery likelihood, control measures. This is what the simulator is going to do for us. Then ecotech sensor. This is another system or device that is going to be very useful. Risk detection, data gathering analysis. Data has a lot to do when it comes to either the prevention or either the management or either the even reoccurrence to prevent the reoccurrence. Then quality monitoring, emergency alert. Emergency alert is very, very important because if we have a biosensor that can easily detect most of these very outbreaks, it can be easy for the researchers or it can be easy for the policymaker to actually enact policy or regulation that can help to safeguard or to protect people. Then prevention guides. Then we have a green system modeling. This is the thought I also put together that imagine 500 millions of years ago, there was nothing like this very problem. And also, the world was just evolving. And the balance in the green-brown system is what has kept that very balanced and that very healthy ecosystem that we had then. If we can reimagine to design and model our green system, of course, we can achieve what we are all yearning for today. Sustainability design of this, eco-services analysis of if we combine certain population of plants, certain population of animals, certain population of microorganisms, certain population of to against the certain population of human beings. What are we going to get? Are we going to get the balance of the climate? Are we going to get the balance of the response? Are we going to get the balance of interrelationship? That is eco-services analysis. Then species performance. What are the performances of the species, of the plants, of the animals, of human beings that we are having within an ecosystem? We need to evaluate it. Then we need to use that one to model how we want our health to be. Then predictive composition. If we are able to assess the species performance, we can actually make a predictive composition where we have imbalance in the species. We can use predictive composition to make up with it. Then functional efficiency. Then eco-health monitoring. Eco-health monitoring is going to help a lot in getting right our green system modeling. Then what are the possible challenges to the integration? Yes, if we want to integrate the environment into One Health, we are going to face some challenges. And the challenges that I have put through is different priorities and language, different professions, different research niche, different aspects of our life are having different priorities and languages. Certain governments don't even have their focus on what we are actually discussing today. But how can we harmonize? How can we get their buy-in into this very One Health concept or project? Then there is need to look at this very challenge. How are we going to communicate? How are we going to shift from the barrier of confusion and also difficulties that can mitigate against the implementation of One Health program? Then funding and constraints. This is a huge problem. This is very, very huge problem. Then another problem is the structural fragmentation and coordination. It has, like, we have identified that there are different stakeholders, then there is going to be a clash in coordination because allocation of resources, priorities, planning, execution, implementation, and different things are going to clash. How can we harmonize? It's going to be a challenge. Lack of data. This is where another issue is that is very huge. That is going to be a very challenging concept because if we don't have data, accurate data, informative data, well organized and interconnected, integrated data to actually speak to the challenges, there is no way that we can get it right. Then socio-cultural and political system differences. What is happening in Europe may be different from what is happening in Africa. These socio-cultural differences are going to be a barrier in achieving the One Health successful implementation. But we have other opportunities that are open when we integrate environment into the One Health, which is an improved cross-sector communication and collaboration strategies. Of course, the challenges are going to push us to actually look at how we can communicate and collaborate. And it's going to open up so many opportunities, so many opportunities. Then innovation in technology and data sharing is going to help us to integrate our data and focus on one objective that is going to be to save the world, to save humanity, to save the biodiversity. And that is where the opportunities lie. Then policy development and advocacy campaign is going to help a lot. The people that are going to advocate, the people that are going to formulate policy to actually have something to work with, that to the benefit of humanity is going to help a lot. That is a very fantastic opportunity that One Health is going to offer us when we integrate the environment into it. Then when we look at the One Health as a concept within the SDGs, what are we talking about? We are talking about the interconnectedness of human well-being, economic development, and environmental sustainability, specifically when environmental factors that impact human health, food security, water availability, life in water and land, and other development outcomes. That is what we are going to achieve. And One Health approach, as it is as a concept, that is well defined for the concept of health for humans, for animals, and all living on the planet. Then we are going to achieve that the SDGs are 3, SDG 11, SDG 13, and SDG 15 and 17, which is all band about human well-being, sustainable city and community, climate action, biodiversity conservation, both in the water and the land system, and also the partnership is going to help us to really achieve it. And in conclusion, I want to say that integrating environment into One Health approaches is not just a step towards achieving the SDGs. No, it is not. But it is a crucial leap towards creating a world where human health, animal health, and environmental sustainability are responsibly supported for ourselves, not only for ourselves, but for the planet. Not only for the planet as it is now, but the future generations that are yet to come. And of course, if we get it right, definitely we are going to leave a legacy behind that is going to tell the story of the emergence of the world, the events of the planet, and history of the contribution of everybody that has lived on this very planet. I thank you all for this very opportunity, and I so stop here. Thank you.
It was a full power-packed presentation, Dr. Shahid. Really amazing it was. You are just unstoppable, right from the start to stop. You didn't miss anything, which is on the action. In fact, 6 of integrating the environmental into One Health. It was a brilliant one. With the increasing recognition of the health of the humans, with the domestic and the wild animals and plants and the environment, to show the closed linkness and the interdependency, and in every form of environmental degradation, that giving the direct and the negative, indirect negative consequences, everything with the effects of air, water, and soil pollution, the human and the healthcare, and which are totally well documented and presented. For example, leaving not aside the biological and the chemical pollutants within the wastewater and the runoff in the livestock, and the enhancing the propagation of the antimicrobial resistance, definitely, and also about the land use and the change driven of the agricultural, industrial, urban expansion, etc., all contributed so well, and it was a full sum up to prevent. And also, I love the conclusion part of it, to prevent and mitigate these threats. The importance that you focused on the biodiversity conservation, environmental, the public health, the animal health, the veterinary sectors. We need to understand the interlinkages, beautifully presented, really, and speak with one voice, implementing One Health in a most harmonious approach. That's really beautiful. And the mandates and the priorities of the environmental sector need to be fully integrated. Totally agreed with you with the One Health approach, including the integrating environment with the data. You didn't miss that. Beautiful. And also the decision making and the fostering for a better understanding, creating awareness of the environmental issues in One Health community, addressing the challenges, boosting the capacity of the environmental and all the stakeholders of the institution to have an equal voice of one unison of one voice towards the One Health table, and in the process of decision making to protect and restore biodiversity, prevent the degradation of the ecosystems and the water and the environment, to jointly support the health of the people, animal, plants, and the ecosystem, underpinning sustainable developmental goals of the 13, 14, 17, and last but not the least, even the 17 one that you have covered. Beautiful, amazing presentation, Dr. Zaid. Very proud of. Thank you so much. Thank you.
So we now move on to the next speaker.
Yes.
We will be listening to the One Health, the link, the integrating. But then now comes the very, very important of how to execute and bring about this One Health into the world. And for that, we need a very, very important vitamin, which is vitamin M. And basically, without funding and investment, nothing moves. And to speak about that, we have with us Professor Dr. Jose Luis Esteves. He's an entrepreneur, mentor, CEO of Exponentialis platform, and he's an accomplished senior executive with diverse experience. He's a manager of corporate and education strategy, manager in public administration and third sector, an agent of Inovatia Brazil 2021. With a strong academic background and international exposure, he has spearheaded many projects in marketing, human development, finance, and many more. And Professor Esteves is a recognized figure in third sector and CSR initiatives, known for designing and social programs and fundraising campaigns. So his expertise spans in international negotiation, strategic planning, business intelligence, and government accountability. He's a sought-after speaker, prolific author, and a driving force in sustainable development. Beyond his professional achievement, Professor Esteves is a committed advocate of sustainable development. His role as a goods ECLAC, I don't know if it is pronounced that way, GUDSECLAC, UN Specialist in Sustainable Development, underscores his dedication to shaping a better future for all of us. So Professor Esteves' accolades include National Child Award in Social Education from the Abrink Foundation, and he's a 3-time recipient of the BEM Efficiente Prize Instituto Canitz SP. Welcome, Professor Dr. Jose Luis Esteves, and we're looking forward to your inputs on how to bring in the funding and investment to bring about the One Health in the entire world. The stage is all yours.
Okay, thank you very much. It is really an outstanding opportunity to be here with all of you, my dear fellows and researchers. Please accept my warm greeting from Brazil. We are reaching noon here. It's about, noon time. So we have a really huge time difference. But unfortunately, due to the fact that we are now very useful of these online platforms like this one, we have always the pleasure and the opportunity to share our thoughts, our knowledge, or humble expertise. And on behalf of the sustainable development and this important issue and subject that we are discussing now, that it's if we consider all the subjects and matters that we discuss on sustainability, probably is one of the newer ones, that is the concept of One Health. So I'm very proud to be here with you, my dear colleagues and fellows, on behalf of also of a lot of umbrella organizations that I belong to, that I always like to bring to a discussion like that, because I do believe that we have to share and with anytime, without constraints, everything that we discuss for on this subject of this important subject of the achieving a more sustainable future. So thank you very much for your invitation. Thank you for this bright mind introduction and speeches that we had today. We had a very wonderful experience to learn about not only the concept of the One Health, but also to approach very closely everything that we can act from agenda into action in this framework. So that's the reason, the main reason that brought me here to share with you some thoughts about this particular aspect that is addressed in terms of the connection between One Health framework, concept, and the university, the higher education institutions, because I do believe that we have to foresee a possible, build bridging with the university in order to boost our search for this coming into action development of the One Health around the globe. So I would share with you my screen, and I'm taking also the opportunity to put in our chat here, and I, of course, it's totally allowed to share my connections with within the LinkedIn, that is a professional network, a short bio and resume linked to the health management and the professorship in this area, and also link to my academic and professorship labs platform, that is a government platform that put together all the stuff that we do as a lecturer, researcher, professor along this past 30 years of intense and huge activity connected to the higher education environment here in Brazil. I would ask your permission, and thank you very much. Special thank to our fellow Dr. Srividhya Sukumar. I hope I pronounce it well or not so badly. That made this prior invitation to be here and with this fantastic mind gathering today. Thank you very much, and I extend from her to all of these beautiful organizers about this, mind gathering, huge mind gathering that we have in this morning here in Brazil, probably afternoon and night in other countries of the world. I will take your permission to share my screen with a small presentation that I try to make in order to address. I hope that you all are able to see.
Yes, it is great.
Okay. And then I would like also to make a bright connection about this with the SDG 4 that is linked to quality education. I had the pleasure to be connected with a network among all the networks of research and professor networks that I have been linked during this past 30 years in my life. That gave me extraordinary pleasure. That is Global Sustainable Futures Network through partnership that is bravely headed by our Professor Dr. Renuka Thakur. So I am extending my, hello and thank to Dr. Renuka for being this effortless person in the head of this international also gathering of minds that we are now represented almost all around the globe with our presence as coordinators, local coordinators and partners of this network. And of course, to send my personal and professional thanks to you that have gently organized this speech today. So let's start with something that we have been discussing during all this morning here, and that is hugely, umbilically connected with the well-being of our planet and inhabitants. So that we will try to talk and address a very, fast, but I believe reliable perspective and point of view about the intersection of One Health and fostering sustainable future and cultivating a culture of innovation within higher education institutions. So I am this person, so grateful for this invitation. I have tried to disseminate it in my professional networks too. Hope that we have a background of persons attending our Facebook streaming, live streaming at this very special moment today. I have been proudly and heavily introduced, so I will not spend any second talking about myself, but it's true. I have done a lot of things, and some of those things in the academy, in the higher education institutions are connected with the health and health management and and the health curriculum profile too. This is, an assorted umbrella of organizations that I am involved in this very specific moment of time. And of course, I'm adding a couple of these two that are, promoting this gathering today here in the morning in the coming future. And this is a special thanks to the Global Sustainable Future Network for give me the huge responsibility of chairing this SDG 4 that is linked to our discussion here today. Well, there is no doubt that the future arrived and brought us a hard impact on the global society. And I share a lot this picture, and for those that are not able to see us on an appropriate way, I am showcasing our mother art wearing a face mask, that is a brave representation of the period that we have lived during this COVID-19 pandemic that affected us globally. And in terms of education, I do believe that we have as a second most affected area around the globe, because according to UNESCO, we have had around 1.5 billion students outside the classroom for a period of almost 2 years. And the impacts vary depending on the country. You have suffered these impacts, but we all agree and we all believe that everyone in every place around the globe suffered a lot with this COVID-19 global pandemic. So it arrived and it definitely changed the way we address things, even in academy and higher education specifically, because we can no longer afford to come back to a point at the end of the year 2019 and the beginning of the year 2020, when these global pandemic started in a small city of China called Wuhan, and from there spread around the globe. So we have to change. And why we have to change? Because if we start to build a connection about One Health in Brazil, we will foresee, according to researchers, that our eradicated diseases are returning to manifestation here in the country. Brazil, for example, saw the re-emergence of disease that was thought to be definitely eradicated in our territory, the yellow fever. Like this disease, others such as dengue and malaria reveal an increase of the number of cases that worries the government and, of course, the scientific community in our country. As a way of discussing and combat and prevention and to draft some more reliable prevention models, SBPC, that is our society here linked to the area of science and research, promoted during this 52nd annual meeting, the symposium that was called Emerging and Re-emerging Diseases last year. So I'm bringing to you a very reliable and update data from Brazil in terms of what we can use as the background of information to add some spice in this discussion about One Health and the link and the possible link with the higher education institutions. And this is a fact, and this is a reliable enforcement of our need, because we are now dealing globally with the fact that we had a common enemy to fight, that is disinformation, fake news, and negationism that affected us a lot, specifically here in Brazil during the past 4 years that we have, up to this new government that are trying to put things in order again. The country, for instance, stopped investing in sanitary prevention campaigns, which was the way to eradicate some of these diseases. And I bring here to highlight some useful data for those that are not very, accustomed with the profile of Brazil in terms of this subject that we are bringing to this front scene today. Last year alone, we had over 630,000 cases of malaria reported. That was an increase of around 30% if we compare to the year 2021. If we stop a little bit and make a step backwards to see during the 70s, when development policies were increased in the interior of the country, for example, malaria was under control with an average stabilized around 50,000 cases per year. So as you can see, we are growing and growing exponentially in terms of diseases that we bravely combat with a regular effort in the past decades. And half of the world's population is at risk of this disease that in Brazil alone kills around 107% at least a year here. So there is a fundamental or a key role to higher education institutions to support this framework of One Health globally. The first one is the participation of universities in this effort to eradicate diseases is fundamental. Thought the productions of these theses, research, manuals, mechanisms that increase knowledge about diseases need to be in place and updated. So this is one thing that we have to bring to the front stage of the One Health discussion, and why this connection with these higher education institutions is so important to advance and to boost ahead. Of course, the One Health Exponential Hub initiative, this is just a spice that I'm bringing to this discussion today, because this is an initiative that we would like to boost here and build a health tech dimension at higher educations in order to accelerate this One Health framework and support with this health tech dimension, the sustainability reform curricula in every possible area. We are not talking about health sciences, we are talking about engineering, like the examples we have saw in some of the speeches we were proud to see presented today here. But of course, the question is how to access more funding or seed funding, and so that's why I am making here proudly an announcement of this initiative that we would like to put in place, and I only believe that it's possible to go further if we join our efforts. So come and join to bring from the agenda into action. And of course, this are some of the contacts, because I'm in the forefront, in the battlefront of this initiative here in Brazil, but I am inviting you all to be a part of this. The concept of One Health, we have been discussing a lot here during the morning, but I would like to bring this concept more close as possible to sustainability, because it holds an immense significance in today's interconnected world, as we already saw here. It emphasized the need to take a holistic approach to solving complex global challenges, such as the spread of zoonotic diseases, the climate change. By the way, I am a climate leader also here in Brazil, so I have to be in the front of the climate change discussions that happens here, and to connect with the climate discussions that are happening worldwide. The food security issues and so far. Sustainability, on the other hand, and that's I try to detach and to highlight just in the middle of this intersection of this very common and ordinary circles. that point out the framework of One Health itself. On the other hand, is the cornerstone of a prosperous future. It involves responsible resource management, ethical practices, and a commitment to leaving a positive legacy for generations to come. So that's why we have to build a very specific integration model in order to address the One Health framework and to bring the sustainability together with this and prove it as a reliable opportunity to make an enhancement, a more credible evaluation of our curriculum metrics in the higher education institutions. So we have to do this by integration of the principles of sustainability with One Health. And it means striving for equilibrium in the ecosystem, ensuring the well-being of all its components. So we have around these economic viability, social acceptability, environmental responsibility, the dimension of human health, the animal health, and the ecosystem health, of course. And that's why higher education institution, they have to be foreseen as catalysts of this change. So I will make a draft of what happens in terms of usual regular presentations when we discuss about higher education, any subject, because I will put stakeholder in the center of this discussion, and I will flourish this discussion with university management, with a student that might have a student-centric curriculum, faculty, staff, funding agencies, government, etc., because they will have to be involved and committed with the discussion in our battlefront of bringing the One Health framework to life. And the whole of higher education institution is also shaping future leaders and professionals, because higher education institutions play, in my opinion, of course, professional opinion, that I can release, because I do not have to be afraid of release any of my impressions, because I do have around 30 years of experience, professional experience as an educator here in Brazil. They have to play a pivotal role in shaping the next generation of leaders and professionals, because through comprehensive education, through critical thinking development and ethical guidance, these higher education institutions equip students with the skills and the values that are necessary to achieve our necessary demanded, let's say, leadership roles. And of course, by fostering an environment that encourages growth, creativity, and collaboration, higher education institutions empower, and empowerment is another word that was very updated up to the 90s and then fade out, and now it's fading again to our higher education and learning environments, because we have to make this empowerment to individuals in order to become, with this empowerment, a positive change and bring the leadership and competent professionals driving positive change in various and the diverse myriad of possibilities in various spheres. So with their diverse resources and research capability, intellectual talent, higher education acts as hubs of innovations and drive possible solutions to complex challenges. So this is the capacity of higher education to drive change, innovation, and a culture of health and sustainability, of course. I do not accept to talk about curricula or higher education curriculum metrics without discussing the subject of bringing sustainability to them, because otherwise we will bring in upfront to the Generation Z and millennials in the soup of letters that we have, you know, that became with the BBs, the baby boomers, and was guided to the X generation and then to Y generation and to Z generation. And now we're talking about digital natives and so far. We have to press then to drive this transformative change. We have to allow them to fuel innovation and instill a culture of health and sustainability. And we cannot work any longer outside this. This is my, of course, professional impression and that I hard believe. And there is a potential impact of higher education on local and global health challenges. They wield significant influence in addressing both local and global health challenge. Just we saw much more closely right now because we have the aspect of the internet and the social media driving the information and unfortunately driving also the disinformation about what we have in terms of the COVID-19 pandemic worldwide. But through research, education, and community engagement, higher educations, they shall contribute to the development of effective strategies to combat diseases, to promote healthy lifestyles, and to, of course, enhance health care systems. We are talking about the hugest in the world that is located right here in Brazil, and to experience, a huge public health system like we have in Brazil that is attending on average 150 million people in the country at the same time. We have in the second place Mexico, but Mexico has only about 60 million. So Brazil is really huge. We are definitely a continental country, and despite of the fact that we deal with the nonsense of being one of the 10th largest economy in the world, we have the unprecedented inequality gap happening here. So if we compare some regions in Brazil in terms of social health and advancement, we probably will be talking about indications that are linking us to Africa and some other continents around the globe. Unfortunately, because we do, I would like to highlight, we are among one of the 10 largest economies in the world. Why it is still happening here? Of course, there is also another potential impact of the higher education's local and global health challenge, and I believe that their collective expertise are about to transcend in this world of TICs, technological and information systems, enabling us to collaborate with diverse stakeholders to find solutions that have far-reaching impacts. And we have also heard about far-reaching and the need to be far-reaching impacts in this present time. Of course, not to name a lot of possibilities that we have to address and to highlight the impact of a higher education institution in this local and global health challenge. I believe that higher education institutions' commitment to advancing knowledge and fostering innovation directly contributes to the improvement of health outcomes worldwide. We have saw this during a different period of time, and mostly we were in the middle of this while facing the impacts of the COVID-19 pandemic globally. Embracing the principles of One Health and sustainability is not just an option, it's a necessity. So that's why I heartfelt the possibility of coming here and to humbly try to make a connection with this, because through the universities, through the higher education institutions, through this broad variety, both in the public and private education ecosystems in our countries, we can address more effortlessly the meaning of bringing some investment and some extra funding to the One Health framework worldwide. As we do face unprecedented challenges like the post-COVID-19 pandemic and climate change, our principles of One Health offer a roadmap building resilience, fostering innovation, and nurturing a world where both planet and people thrive in harmony. So that's it. And just trying to make, by understanding and addressing this intricate web of relationships, we can pave the way for a more resilient and sustainable future. This is why I believe when we discuss the One Health framework globally, we will have to put the education, the SDG 4, in the center of this, bring this to the center of the state, because without this, we may achieve very good accomplishments, because we are effortless. We are looking forward to do this, but we will lose a very important stakeholder and connection to spread the word of One Health in a global dimension as we do live, and from these stakeholder to the whole society, because we are talking about a very powerful education connection, both in public and private ecosystems. So, of course, here a warm greeting from Brazil to you all. Thanks for attending and allowing me to share this perspective with you. I am bringing here my contacts. Our training, advisory, and research services are at your hands. Thank you very much for this invitation, and I hope we do have a second mind gathering with a more specific amount of time to discuss further this, and of course to improve everything that would be possible after this connection that we have started today. Thank you very much. I will stop now presenting my sharing screen, so I can return to a personal mode. And I would like to, well, I am just putting there also in the chat while I was talking to you, the drive, that you can access, and it can download this humble presentation. Thank you very much again.
Thank you, Professor. It was a quite comprehensive, yet though detailed presentation when it comes to the finance and the integration of financial aspects into the OHED that we are talking about. As you rightly said, the significant and sustainable streamlined financing is very critical. And yet, though relating it to the SDG 4 of quality education, it is very necessary to put awareness into action of OHJPA, that is One Health Joint Association, into action, fostering greater efficiency and coalition building to support countries in operation of the One Health at a broader scale. That's very important. And also we see a point of working together, of working in collaboration with wide range of factors as funding partners, enabling integration into the package of global goods and the sustainability and the security with the technical support of the countries, with the leveraging longer term, more sustainable and financial investments is very, very important asset. And to ensure this, and to ensure mobilization, which will be worked as a team with resourcing partnerships, with key lines, and providing integration support for the governance and also the resource mobilization endeavors to avoid fragmentation of the effort, which is very, very important. And also when it comes to the funding, what is very, very important is that taking it forward, as you rightly mentioned, that you have already shared this with your people, with your community. That is very, very important, so that people become aware of exactly what we are doing, what is the main rationale behind it, what is the confinement, what is going to happen, and how to take it forward. And we can take your suggestions as examples, which we can duplicate and we can integrate it into our system, such that sharing of knowledge and our creating an awareness campaign is also very, very indispensable in moving forward. Thank you so much, Professor. That was quite valuable suggestion that you have just made your mark over here amidst us today. Thank you so much. Thank you. Yes, we have come towards the end of this session, and definitely it was, I think it was some, we have covered almost everything, and with one point, with one focus, with one unifocal thought, that we have got only one earth. We don't have another earth to just depend on. And we can see that each one's participation is coming towards that, saying that I'm going to do this. This is what is to be done. As an educationist, I'm here to contribute this. As a person in the community whom I'm working with, my stakeholders, my people, I'm doing this. I'm from this country, I'm representing Nigeria, I'm doing this. I'm from Brazil, I'm contributing this. I'm from UK, I'm doing this. So that's a wonderful, fabulous knowledge sharing platform it has evolved into. That's to be really congratulated for all the massive effort that has been put into. My sincere thanks. I thank each one of you for your precious time that you have taken for being with us today and for making all your preparations from your side. Thank you so much. Thank you. It is a wonderful, commendable support that has been extended to us on this platform. Over to Dr. Nada, the captain of the ship.
Thank you. Thank you. First, I want to thanks to our great Dr. Jose Esteves today. It was really, at the end, an amazing presentation about the well-being of our planet and its inhabitants. It is our mission. You share really a lot with us that our future is arriving and bringing us a hard impact on the global society. So stopping, investing in this prevention, making campaigns, going through the statistics, telling us what you are doing in Brazil, how to find the funds, how to come, how to bring, how to join. What about the concept? We know that, as Dr. Srividhya and all today on this great platform say, we have only one health, we have only one earth. So we need to take care about and need to have healthy ecosystems, healthy humans, healthy animals. And it is really significant today. If we take and emphasize this, giving this, you gave us a holistic approach today, solving so many problems. We know that we have big challenges, complex global challenges, spreading aware of us. I like the pyramid. I like the pyramid, what you show with the ecosystem, and how can we integrate the principles of sustainability in One Health, and what is the meaning of One Health? Because today so many don't understand that the health is for us the most important thing, and if we want to talk about the well-being, we need to, as you say, strive the ecosystem equilibrium. So higher education, not only higher education, starting from the preliminary education, starting from our little children who are making from kindergarten, making so many actions to do this, and we want to thank you. We want to thank you that you today show us that we really need to understand that we need to address all these relationships. And I'm sure here on the IIU stage at IIU with great G20, with our great Dr. Srividhya and our founder, Piyush Pandit, we will achieve that, because today today we are finishing one session, but tomorrow we are already continuing another. And I want to say that each one of our today esteemed guests talking about the main topic, One Health Quadripartite, and I'll start from each one because curbing the silent pandemic of AMR by our great Dr. Herbert, it was excellent. It was excellent from South Africa, coming to United Kingdom, reducing the risks of emergency and emerging the zoonotic epidemics and pandemics of our amazing Cliff, Professor Dr. Augusta Elizabeth. Then, coming in Croatia, talking about the global upsurge and food and water safety hazard. Thank you there, Sanja Zrilic. Linking other things, raising the awareness today. Dr. Shyama, the links all between the health of the environment, human, animals, and plants. Integrating the environment into One Health by our great Dr. Sahid. So, finishing today with our estimated speaker from Brazil. We really will celebrate, collaborate, communicate, catalyze all the changes to contribute to the citizenship, community, and country. I want to say for our next Sunday, please let be with us to our next Sunday because we're coming to with a new topic with the new G20 International Global Summit on the topic International Financial Architecture. What it means, it will be the presidency of accelerated, inclusive, and resilient growth. What is the meaning of accelerated, inclusive, and resilient growth? So we will have new topics. We will emphasize on the enhancing transparency and the accountability of the multilateral financial stability. What is the meaning of the financial stability? Do we know the models? What about the LMS model, Mundell-Fleming model? We have so many models in the financial institution, which we need to understand. Why? What is the situation today? Inflation, what it means to be recession. So promoting greater integration across the financial market. What is happening on the financial market? How to strengthen financial systems and capital frameworks? How to manage the financial crisis and economic challenges? I'm sure that each one today wants to know the question on this. How to manage financial crisis and what are the economic challenges? How we are solving these economic challenges. And we cannot do nothing if we don't take care about the climate changes. We know what is happening. Climate changes policies on the capital flows, perception of the investors. So we are welcoming all the researchers, experts, leaders, innovators, and change makers to join us again at the next Sunday. And yes, we want to thanks to our great founder, Sir Piyush Pandit, for giving us this opportunity, for giving us this great IIU stage, IIU University, as we said, registered in 4 countries and also continuing registered in so many other countries all around the world. We are everywhere. IIU is strong. IIU is a revolution and we are really everywhere. So next, we have a great team. Our team is showing what we are doing. We are united. We are together. Nothing can destroy IIU. IIU is stronger from day to day. So, Dr. Srividhya, please let us continue with your vote of thanks and we will finish this amazing session today. More than we are here 3 hours and 30 minutes. So I hope great audience. Thank you. Thank you for being with us. Thank you for being so supportive. Without you, we could not have this amazing event. Thank you. Dr. Srividhya.
Yes. Thank you, Dr. Nada. Thank you so much. Thanks for your plenary of informing about the next week as well. Thank you so much. That was really brilliant. Thank you. Over to Madam Sandhya Balaji for briefing about G20 sessions in the projects, forthcoming and the previous ones as well. And we have Dr. Inga with us, who is going to give us the vote of thanks. Thank you so much. So over to Madam Sandhya Balaji. I'm ready to share the screen.
Yes, thank you.
Yes, madam.
Yes, so we began our sessions in the beginning of July, that is on the 9th, and we started talking about Education 360, which was to talk about equitable and learning opportunities, lifelong learning opportunities for all. And then the next week, we talked about the power of women and youth and how it leads to sustainable development. Further, on 23rd July, we talked about digitization and innovation with importance to science stream, vocation, and employability. 30th of July marked entrepreneurship and MSME, with our presidency being modernized and strengthen the industrial units to make them globally competent. The month of August began with energy sources and resources leading to sustainability and employability. And then further, the next week on the 13th of August, that is today, we have discussed, deliberated, and contemplated how One Health, or health is wealth, and how it can lead to the One Health Quadripartite, leading to communication, collaboration, and catalyzing and contributing to the community and the world. So the next week, we will talk about inclusion, financial architecture, and international growth, with our presidency being accelerated, inclusive, and resilient growth. The week after, on 27th August, our discussions will be on international taxation, trade, and investment, with exports and imports. And our presidency will be to reform, reshape, and restructure and reconstitute the international tax architecture. 3rd September 2023 will mark the discussions on heritage, culture, and tourism. On the 10th September, we will look forward to our way forward on the 2030 agenda and sustainable development, with our presidency being accelerating progress towards the SDG for an ambitious G20 action plan. And on 17th September 2023, we will conclude our sessions with a validatory function. That's it from me. Thank you, Dr. Vidya.
Thank you, Madam Sandhya Balaji. Thank you so much. And now I really look forward to Dr. Inga to give us the vote of thanks.
Hello, can you hear me, team?
Yes, yes.
Oh my God. Congratulations. Congratulations. Really, it was amazing.
She mentioned to me like she had a weak signal, but still she said that she will do the vote of thanks. Definitely. Yeah.
Yes, she has a weak
amazing job. Wow. We already, it's up to us how we use it. Should be information. It's important issue, important topic. Wow. Those how have heard this important information are sure now at a higher level of knowledge. Congratulations, team. Today I have climbed one step higher on the ladder of success, for which I am very grateful to the organizers, of course. All the speakers were amazing. I was really excited by the presentation of all the guests. Thank you. Dr. Srividhya, Professor Nada, Dr. Virginia, Dr. Sandy, of course, Dr. Snitka, dear Ermina, respected Roshni ma'am, and especially Mr. Peyush Pandit. Thank you so much for this amazing opportunity. Team, today we learned a lot of important information. Thank you. And of course, thank you very much on behalf of this teacher of Georgia, of course. Thank you. Thank you so much. Congratulations. Well done. Thank you.
Thank you, Dr. Inga. Thank you so much. Thank you. Thank you. Thank you one and all for such a beautiful presence. And we don't want to end this session, to be very frank, because the thoughts which were shared were so amazing, and no word to explain. They were out of word, and really each one was so different, and there was no repetition of ideas. Believe me, there were no repetition of ideas. Right? That is to be really congratulated. Each one was so different, and each one was so very important. so significant to that One Health, really. And we can really see that how far you have taken into yourself for relating that One Health to One Earth, which is G20's objective, G20's rational. Thank you so much. Thank you all. Thanks for your precious time, and thanks to our sincere thanks to Mr. Piyush Pandit, the founder of IIU, who has created this platform. Though we don't get to see him, his presence is always there with us as a visionary. Thank you, sir. Thank you so much. Yes, Dr. Nada.
Thank you. Thank you, Dr. Srividhya.
Thank you
Yes,
all. Team Nitin.
thank you, Dr. Shriyama. Thank you. Thank you so much. Thanks to once again to all our esteemed guest speakers, to all our participants, to all our audience, to IIU, to G20, Dr. Sani, wonderful job, Dr. Srividhya, thank you. So we come really to the end. Till our next session, next Sunday. Stay safe, stay healthy, and let us continue grow, learning and growing together. So before we left, I want one group photo. So please, can you open your camera, Dr. Elizabeth, if you can? Professor Sanya, please, if you can, open your camera.
Dr. Herbert, is it
Yes,
possible to
Dr.
open your...
Dr. Herbert, if you can open your camera, please. Okay, I will make it. So even I want a big smile. Dr. Elizabeth, big smile, please. Yes. Thank you. Thank you so much. So
Thank you all. Thank you so much.
thank you all. Yes. See you. Bye. Bye-bye.
Bye. Until next Sunday.
Yes.
Yeah.
Bye. Bye-bye.
Bye, everyone. Bye. Have a good day.
You too. Bye-bye.
Bye.